Okay, it's 6 o'clock, let's start.
Know what happens when we don't.
We have a quorum.
We have a forum
Yes, we do have a,
and posting of the agenda. Yes,
yes.
any announcements to the change to the agenda?
That's what changed. Yes,
Okay,
I'm sorry.
go ahead.
It's just gonna bear. First of all, you have before you on your table a letter that's members of the executive committee on homelessness, and we're going to talk about that later, but we're going to ask for your approval to send the letter, so I'd like to add it to the agenda. We would need be doing this for a meeting that's tomorrow,
Yeah.
which is why it's important to do. So that would be an action item. The second item that I thought we should add to the agenda is just a discussion at the end of our COG reports on emergency preparedness and fire preparation, and if you want to talk about anything about what's going on. So those are the two items I'd like.
So moved.
Second.
Sorry. Any opposition? Any abstention?
Okay,
Here,
yes.
something we talked from, P2P.
Oh.
Okay.
80/20/49.
Okay, so we do have to do our due diligence on this, so we need a motion to approve,
Having her join us.
to have her join us.
So moved. Second.
Have the first and second, right?
Any opposition?
Don't you have to take a roll call?
I do.
One after she joins.
Yeah, exactly.
Okay.
Any opposition? An abstention?
And don't we have to ask her,
Yeah,
if
good.
there's anybody 18?
Yes. Councilwoman Clark, can you hear us?
I can hear you. Hi, good evening.
So we've approved your AB 2449. We just need you to verify that either there's nobody under the age of, or over the age of 18 with you, or if there are, if you could identify them for us.
No, there is no one over the age of
Thank
18.
you.
Thank you.
Thank you. Uh-huh.
Okay,
And Jocelyn from District 2 is here, but she is not voting.
hi Jocelyn.
Hi, I'm just about 10 minutes away. I'm so sorry I'm running late.
Oh,
so
no,
she's
no,
not-
no worries. Take your time to be safe. Okay, so let's see, we need to go to comments from the public.
We have one from Eric Muscat.
Thank you, Chair Tanaka.
Yes,
Eric Rodriguez, the LA County Government Affairs Officer for the Southern California Association of Governments. I know it's a mouthful, but I just wanted to update just what's SCAG is doing with the LA County fires. Fires have erupted earlier this month, continue to threaten our communities, as you know, around the region. Company work is already underway to reduce the disruption and displacement of residents and businesses affected by the fire. Recently, the Los Angeles County invited SCAG to join two crucial and critical task forces led by the Los Angeles County Department of Planning to aid in the rebuild and recovery of the Eaton Palisades fires. Other individuals and organizations will be included in these two task forces as they become more active. And SCAG will continue to provide updates and activities and who those other organizations are joining, and some of the announcements that will be coming and emerging from these task forces. In terms of long-term planning and resilience, I'd like to highlight SCAG's Regional Climate Adaptation Framework, which helps local jurisdictions in Southern California plan and implement strategies to adapt to climate change's impacts, including wildfires. It provides tools, data, and best practices for building resiliency in infrastructure, housing, and natural systems. The framework supports collaboration between regional and local entities to address climate vulnerabilities and integrate adaptation measures into local planning efforts. SCAG will be releasing new resiliency tools in 2025, including a new wildfire risk screening tool layer as far as an update to the housing, environment, and land use parcel tool, which all is available online, and a new resilience toolkit with information on planning for resilience. This month, SCAG's Joint Policy Committee meeting, which is a combination of all of our 3 policy committees in our regional council. We're joining on February 5th, which is on Thursday, which will center on discussions on recovery and resilience, lessons for the region, including SCAG's involvement with the LA County Recovery Task Force that I just mentioned earlier. The agenda for the meeting will be published in 72 hours, but I do know that Dr. Lucy Jones will be one of our speakers. So we always love to hear from her. If you have any questions, I'd be happy to address that at this time. Thank you.
Are we allowed to make comment even though it's not on the agenda? Because I have a comment.
I'll let you do that, but
So I think what SCAG is planning to do is terrific, especially with respect to being prepared for wildfires. And I hope that this data and the significance of the data might finds its way into the next housing needs assessment formula that comes from SCAG. Because in our area, we're in Rolling Hills Estates, we're in a very high fire risk area. Same terrain as the Palisades. You know, single family homes mostly. We saw the single family homes burn in Palisades, even though they're set back from each other. And so I really hope that the entire state and all of our legislators and the governor take note of this need for density with respect to what happens in a wildfire.
Noted, thank you for that. I appreciate you sharing your concerns and some of the advantages that you may see. I think that is taking place within the next 5 to 7 years, so we have a lot of time to incorporate some of these measures and ideas. So I will take that to the board. Thank you.
Thanks, Debbie.
I know we're not supposed to comment,
No, go ahead.
but I do know that Darren Shitzy, who's an executive at SCAG, did lose his home. And I don't know if others did, but I feel, I wanted to say our hearts go out.
Thank you, Jack. I appreciate that. And our chief operating officer did lose his home in the Pacific Palisades. He's been with SCAG for over 20 years. And I think I saw him for the first time on Tuesday, but he's in good spirits and his family are safe. And I will pass that message, Jack. Thank you. Appreciate that. Thank you.
Thank you, Eric. Appreciate it.
And I would second what we have from Rolling Hills Estates. In Rolling Hills, we're like even worse, but only 3 exits out of our city evacuation, which are 2-lane roads leading to other 2-lane roads. So it's really dire in our city as well. So the whole peninsula is a very high fire area.
Thank you for sharing that. I will incorporate that in my notes.
Thank you.
Thank you.
Thank you. Thank you, everybody. Consent calendar. Anybody wishing to move anything from the consent calendar? Do I have a motion?
I'll make the motion.
Motion. Have a second?
Second.
Go ahead and do the roll call.
Present, Segundo, not present. Urbina,
Yes.
Popcorn,
Yes.
Bosa,
Yes.
Inglewood,
Yes.
Lawndale,
Yes.
yep,
Yes.
Delhi City's not present, and Beach,
Yes.
House City Estates,
Yes.
RPV is not present, Redondo Beach, not present, Rolling Hills,
Yes.
Rolling Hills Estates,
Yes,
Orange,
Thank you.
not present, SD2 is not here yet, and SD4.
Yes.
Thank you.
We good?
Yes.
Okay, so let's move on to our presentation and Jackie's going to introduce our guests.
Yes, and I didn't tell you, we usually speak from this podium, which sounds a little ridiculous, but I'm on a county commission, the Quality and Productivity Commission, and it's quite an honor. I was appointed by Janice Hahn, and we actually provide funding. We're given money to provide funding for innovative projects. And whenever the fire department comes with an innovative project, it's so wonderful and so overwhelming. And it's really a wonderful thing. We always feel so good that we can help the fire department in the innovations that they come up with. And Dr. Kazan is the ethical person at the fire department, which is why he's able to be with us today. And he has been bringing these projects to us. And I was listening to them and I thought, you really ought to know what the fire department is doing for your constituents as they are servicing them in the field. And so I'd like to present Dr. Clayton Kazan to tell you about it.
Thank you. Thank you very much for the invitation. And I will say also, I am a 4th generation resident. My great grandfather and my grandmother both went to Gardena High School. My mom went to Florence.
In the house.
I live in Rolling Hills Estates. So one of the members of the audience asked a very good question, which I think a lot of people don't even really realize, and that is, why does the fire department employ a physician? Actually, we employ 3 of us and 2 pharmacists as well. The reason is, despite the fact that obviously the fire department's brush fire response is front and center right now, more than 80% of the department's call volume is medical. Like, we really are a mobile health organization. And so in order to provide the best possible health, we lead it by physicians, nurses, to support our paramedics with the best equipment, training, and to give them direction about what should we be doing. Everything from when you call 911 and it gets transferred to the fire department, what questions do you get asked? What direction do our dispatchers give you about CPR, compressions, defibrillation, things like that, all the way up to what hospital do we deliver you to and what types of projects can we do? So I really appreciate being invited to share because we've done some really great projects that are benefiting not just the members of the communities that we serve, but also the communities that we don't serve, because I think we're helping to bring our EMS mission across the entire county forward. So without further ado, I'm going to share. So I guess I kind of answered my question. I probably should have turned the slide before I. This is the picture of myself and my two assistant medical directors, Dr. Puneet Gupta and Dr. Saman Kashani. Just a little light. So what is an EMS physician? All three of us are double board certified in emergency medicine and emergency medical services. So people go, well, what's the difference? They both kind of sound the same. The answer is it's emergency medicine after you reach the hospital and emergency medicine before you reach the hospital. And they are very different. I think we way overestimate what emergency physicians' knowledge of the EMS system really is. EMS operations are extremely different than hospital operations. I'm also an attending physician at Little Company of Mary. Dr. Gupta works at Harbor UCLA and Dr. Kashani works at LA General. So all three of us also still have active emergency medicine practices, and all three of us are faculty in the local programs. One of the things that we can do is we can assist with very complex responses. These don't happen very often, but we actually can join in with what's called the HERT teams, the hospital emergency response teams, to go out and respond to people that are entrapped. So these two photos are from an incident that I responded to. You can see the back of my head there in the picture on the left. Up in the high desert in the Antelope Valley, where we responded from East LA by helicopter to a farm worker, a migrant farm worker whose arm was caught in the motor of an irrigation pipe. And then in order to get him extricated, we ended up having to amputate his arm in the field. And actually, I'm going to allude to this in a minute, but this was the first time in LA County that we gave blood products in the pre-hospital setting. So we were able to secure 2 units of packed red blood cells from Antelope Valley Hospital, shuttled out to us by ambulance from an AMR ambulance, and handed to us right as we got in the helicopter to do the flight to Antelope Valley. Both units of blood were in the patient as we walked into the hospital. And the patient who'd gone after we extricated him into cardiac arrest was waking up on arrival to the hospital, was discharged home, neurologically intact 6 days later. Wow. So we work in partnership with the 2 HERT teams. There's one at LA General and one at Harbor UCLA Medical Center. So whenever there is a HERT team response, one of the 3 medical directors also will, if we can feasibly get there, we will go to assist. Because again, the HERT team doesn't really have good knowledge of EMS operations. They really are a hospital surgical team. So being able to speak their language and communicate what our capabilities are in the field requires a physician. When I joined the department in 2015, we were not really doing what's called high performance CPR, and it really wasn't much of a thing across the county. I was an EMT. I'm a UCLA Bruin. Sorry for the Trojans out there, but and we're playing basketball on Monday, so you know what colors I'll be wearing. But when I was an EMT, we used to just document that CPR was performed. Turns out the quality of CPR performed really matters when it comes to the outcome of patients in cardiac arrest. And I often say cardiac arrest is the structure fire of EMS. Most EMS patients we respond on would be just fine to ride to the hospital in a private car. Some of them could even walk to the hospital and be just fine. Cardiac arrest patients are one of the main reasons that we exist in EMS. So if the quality of CPR really matters, then we need to step up our game to improve the outcome of the patients that we respond to in cardiac arrest. So I just wanted to give you a snapshot. I am not going to go through what this is, but this is what's called a CPR performance summary. And this allows us to look at how continuous were our compressions. Was the depth of compression where we want it to be? Was the rate of compression where we want it to be? Were we coming off the chest with each compression at the right rate? How fast were we breathing for the patient? And what was the end tidal carbon dioxide that we were measuring on that patient? This is an example I pulled from Lawndale because I knew I was coming to South Bay City, so I had to pull one that was local. This was a patient that was part of our ECMO pilot, which I will show you momentarily. Unfortunately, this patient did not survive. So when we started with high performance CPR, we spread that across the county. And we look at those CPR performance reports and we give our firefighters and paramedics feedback about the quality of CPR they're performing, coupled with training. So when you see a really good CPR performance summary like that, that is now routine in LA County Fire. When I first started, it was far from routine to see something like that. But with training, they've really embraced it, embraced the mantle of high performance CPR. And to be able to pull one, that was the first one I pulled at random. And it's really, really good. So we started looking at, well, what about environments in which we can't perform good quality CPR? So this is an example of a study that we did. That is a mannequin. For those of you far away, that is a mannequin, a person.
Screen over there.
Oh, okay, yeah. So we started asking the question because we cover Avalon and the waters around Avalon. What about people in the dive park that we pull that are in cardiac arrest that have a 30-minute ride to the dive chamber? So we started looking at what about the possibility of doing mechanical CPR? There are several different types of mechanical CPR devices. So we decided to test it on the mannequins there. And then we even published a study on it in a peer-reviewed journal called the Aeromedical Journal, which is Journal of Critical Care Transport, about manual versus mechanical CPR in a simulated rescue boat operation, and showed that mechanical CPR appears to be very high quality as best we could judge. And so we went to the Quality and Productivity Commission for a Productivity Investment Fund grant we called Lucas for lifeguards. Lucas is the name of the device that we chose to use, and implemented that with our lifeguard program, both on Catalina Island and on the mainland coast. So this is getting nearer and nearer to my heart as I just turned 50 last year. What about patients in cardiac arrest where high performance CPR and defibrillation is not working? We know that there is a significant population out there that no matter what you do in the field, they're not coming back. But there was a great study out of Minneapolis that said, if you can take those patients and you can do mechanical CPR and you can transport them to a center that can put them on heart-lung bypass in cardiac arrest, then take them off to the cath lab and see if you can open up the culprit lesion in their coronary vessels, you can get a significant percentage of them back. Possibly about 40% of them can be brought back. And these are people that are otherwise deceased in the field. Wow. So we started doing a pilot. We went and got funding. We ended up going to the Productivity Investment Fund to get a small scale study going. And then we actually got an Assistance to Firefighters grant to make this department wide to use the Lucas device. This is us filming in our EMS bureau, my office, filming a training video about how to apply this. And then we published a study. And we launched this in 2019 about transporting patients for, it's called extracorporeal membrane oxygenation, or ECMO, which is heart-lung bypass. We structured the study around 4 hospitals that were willing to work with us. So Cedars-Sinai, Ronald Reagan, UCLA, LA General, and Long Beach Memorial. So we actually, in the South Bay cities, we've been operating with this pilot. It's now actually no longer a pilot project. It is now standard procedure, affecting the cities of Carson, Gardena, Lawndale, Hawthorne, actually all the way up Inglewood as well, because Inglewood will go north up to Ronald Reagan. And this has been live since 2019. We are still tabulating our final data from the pilot phase, and there will be more research that we're going to publish. But we believe the number of saves is going to be somewhere in the ballpark of about 15 or 16 saves, neurologically completely intact. These are people that would otherwise be deceased.
Wow.
So we're very, very proud of this, as you can imagine. We are now making the standard of care across the region, and we're looking to expand to more ECMO centers. Lawrence Memorial has reached out to us to become an ECMO center, though that is still early. Harbor UCLA also has expressed interest, and there are a few others around the region, and we're actively trying to get more of them to do it. It's very resource intensive for the hospitals, but it obviously can be a huge, huge gain too.
Since Harbor General has the big trauma center, you would think that would be an appropriate location.
Yes. So we've had the talks with the Department of Health Services. LA General, being part of the same system, was a little bit reticent because there's a huge amount of resource that has to go into it for every save. And the question is this where we should be putting our money?
Yeah, good question.
Yeah, valid question. And I think we have Harbor kind of tipped in our favor. LA General was willing to do it for a limited population, and for the sake of equity also, we didn't want this to only be something that would be available to people in Westwood, Beverly Hills, and because Cedars-Sinai, Ronald Reagan, we wanted to make sure that other Angelenos got an opportunity to benefit from this. So LA General serves a population that's very underserved, and we were really anxious to get them to participate with us, and they did. Some of our saves came from them, but they didn't want to serve an enormous population because of the amount of resource investment. I think they're coming around, in Harbor UCLA, I believe also we've tipped. So they're coming, yeah.
Can you just clarify maybe what is the standard of care protocol before you move on to the next subject?
Oh,
Generally for non-physicians, what is this intervention that you're
Okay.
talking about that's different?
All right, believe me, I could do a whole talk on just this. But if we have a patient who is a young-ish person, we usually cap at about age 70, as the Minneapolis study did. Patients that don't have things like end-stage cancer, end-stage organ disease, so that they actually, because they're not going to return healthier than they started. So we try to start with a relatively healthy population. I'm kind of like the prototype. I have no medical history, really. I'm neurologically intact. And if I were to go down in sudden cardiac arrest, if I present in a rhythm that is generally ventricular fibrillation or ventricular tachycardia, I get bystander CPR, so I have not been down with no CPR for an extended period of time. And we will start and do 2 rounds of our standard resuscitation, which is defibrillation, IV medications. And then, to quote my nurse educator who works in this area, 2 shocks, ECMO rocks. That means at 2 shocks, we start packaging to go. If the patient seems to be a candidate, we call in our base hospital and just notify them, we have an ECMO candidate, we're en route, our ETA is X. And we try and get off the phone and get rolling. The longer the time from going down to being placed on heart-lung bypass at the hospital, the lower the chance of getting the patient back. So time is really of the essence. In Paris and in Germany and some other spots, they actually respond to a physician to put a patient on ECMO in the field. Great photos in the Paris Metro and in the Louvre of a physician actually putting them on ECMO, which is basically pulling out blood from the artery, oxygenating it and pushing it back, and then circulating it in the body. So you no longer have to do compressions. And then once you do that, you don't have to do CPR anymore. You take them off to the cath lab, you do an angiogram and try and figure out what the cause is.
So what's the outside travel distance on somebody like you between the field and the hospital?
What's
The longest length of time that's,
where they'll consider it?
yeah.
About 30 minutes. So from going down to arrival.
Right.
So to figure if we get out in 10 minutes, which we try to do, which can be tricky, upstairs in the back of an apartment building, it takes a while to get a patient out. We try to get out within 10 minutes and off scene, and then about a 20-minute transport time, which depending on traffic, we can make from some of these areas. Yeah. Yeah.
So back when you were talking about validating the mechanical CPR on a mannequin, and you
Yes.
said you found that worked.
Yes.
How can you determine it works if you're dealing with a mannequin?
Because the mannequin is sitting in the audience awake and
asked
earlier
that.
today. No, great question. So we use a monitor called Zoll. There's about 3 different monitors on the market. Zoll has an accelerometer that goes on the chest that actually measures the compressions. So what we could tell is that in the big research studies, mechanical CPR versus manual CPR, there is no difference in survival. However, if you go to move a patient, you cannot do manual CPR. The quality just deteriorates immediately. You see like ER, you see them doing one-handed compressions and stuff. Those are really kind of garbage compressions. But if you use a mechanical device, you can move the patient, you can hoist the patient in a helicopter, as I was told that today happened in previous dates. A diver that was in cardiac arrest got hoisted on the helicopter with the Lucas device giving compressions. Can't do CPR otherwise. So it does, I always say it's like a mechanical EMT. It never gets tired, it never begs for food, it doesn't need sleep, and it'll just keep going as long as its battery goes. So how do we measured and we used the video camera to compare compressions, then we measured the depth, rate, and everything in compliance with CPR standards and showed that the mechanical devices did just fine on the boat. The manual one, I was one of the compressors, it was absolutely exhausting. And it was very hard to even determine because of the movement of the boat, whether we were giving good compressions. Yeah. It was, everyone thinks that I like to do studies we actually published 2 studies on our boat cruise, and everyone jokes that I'm just like the boat study guy. Okay. For our drug, I have to point this out. This is, when people ask, what's the best thing you've done since you came to County Fire? It's actually this. I won't go into too much detail, but we actually launched our own pharmacy. So
Nice.
we used to get all of our medications through the county hospitals. The county hospitals, particularly for controlled drugs, wanted us out because of just drug security. So we decided to launch our own pharmacy. To do that, we had to push legislation through Sacramento to enable us to have what's called Pyxis machines, which are they're sort of smart safes. All the hospitals use them, but EMS was not using them. So we got that legislation pushed through. That's Lynn, who's our first fire department pharmacist. She's our chief pharmacist. She lives in PV Estates, so another South Bay person. And she's actually assembled a team. And the beauty of this team is for disaster preparedness, they keep all of our stations stocked. We don't overbuy like we used to and just waste a bunch of expired meds because they manage our flow. And we have perpetual drug shortages of critical need drugs. So right now we cannot get 10% dextrose, which is our typical med for hypoglycemic patients. So Lynn is able to pivot, get us 50% dextrose, redo our protocols, and we push that out. I don't have to worry about that. She takes care of it. She's phenomenal. Anyone who ever wants to come visit, by the way, I highly recommend it. Come visit our,
Where's the pharmacy?
at my headquarters in Monterey Park.
Okay.
And we have a separate vault with the controlled drugs that we don't give tours to, but the pharmacy operation.
Yeah, come on.
Sorry, I know. Another thing we've been working on is because of our rising call volumes, I think, did I put the graph in here? Yeah. Oop. Come on, there we go. On the left is our call volume since right before I joined the department, and it just keeps going up and up and up. We actually had our fourth consecutive record year last year, and there's no telling how it's going to be next year or this year. And I picked, this is Pomona Valley Hospital, just because I had a photo. I was there that day and snapped this picture. We have more and more trouble getting our ambulances offloaded at the hospitals. They're holding on to them. That is a whole other conversation that is important. But the point is, when the ambulances are at the hospital, they're not responding to our call with us for the transport. And so that has become a bigger problem. But part of the issue is that we're transporting people who really don't need to be in the emergency department because for a variety of reasons, they just have no place else to go to get their health care. So we
Can I
launched the advanced.
Doctor, is there a way in which when you have multiple ambulances waiting to be offloaded, that one could, have one paramedic manage two patients and
Consolidate them.
another
Yes.
ambulance freed up to go in the field?
Yes. Actually, I wrote that very policy for the EMS agency during COVID.
Okay.
Getting the ambulance companies to do it is another factor, and getting the hospitals to give us stretchers on which to put those patients, because the ambulance needs its stretcher back to go back into service. So if we're going to consolidate them down, we need the hospitals to give us stretchers. And believe it or not, some of the hospitals in our system, one in particular I'm thinking of is not in the South Bay, was hiding their stretchers. So we couldn't do that. I don't know why.
Can't they just outfit the paramedic trucks with additional stretchers so you can do that and label them so that you get them back?
Sort of. One of the ambulance companies.
This device on it, you can.
Well, they purchased cheap, just stretchers for use up in the Antelope Valley and some other places to do exactly that, with little army cots. Many of them were thrown away by the hospitals. Well, look, I work in the hospital. I'm not saying hospitals are bad partners, but they're not always good partners. There was some cost with that. And then there's really, other than those little costs, there's not a lot of room in the ambulance for a second stretcher. They take up a lot of space.
You can't
So-
roll them up. They're not
No.
roll up kind.
No. Not anymore. The old types you kind of could, but these days, no. But it's a big emerging problem. But we tackled this from the perspective of, why don't we start providing like sort of a mobile urgent care? We'll go out and provide the simple interventions where the patient is. The picture on the right is one of our nurse practitioners, Ari, that's putting a stitch in a bleeding dialysis fistula. This is a simple figure of 8 stitch, and this is done. It will no longer bleed and the patient can go home and get the stitch taken out in 5 days. Didn't require an ambulance response, didn't require ambulance transport, did not require an ER visit, and we could just cancel. So we launched 1 unit in the Antelope Valley in 2019. We expanded to 3 units in 2022 using ARPA funding, or 2023 using ARPA funding. And the closest unit to here is we call AP 20, which is in our battalion 20. It services Hawthorne, Lawndale, Gardena, Inglewood, and Lenox. And actually has been extremely successful. And we are currently working with the board, thank you for helping us, to secure more permanent funding to keep these going. But unfortunately, this being grant funded is very hard to make permanent because we can't hire people on grants. Because what do you do when the grant goes away? But it's been a fantastic project. We have actually responded to 23,000 patients and discharged nearly 9,000 patients from EMS transport and unnecessary ER visits very, very safely. I would be remiss not to include this picture of Mr. Singh. This is with his permission. Mr. Singh was one of our most difficult, frequent utilizer, homeless, alcoholic, depressed, suicidal patients. We would actually respond on him. So the local battalion, this patient's from up near El Monte, which is where one of our units is posted. And we would get called on him almost every day to transport him to the emergency room. He would sober up enough, he'd leave, he'd call 911 again, he'd want to go to another emergency room. And we would start pre-visiting him. We started trying to connect him with mental health, homeless services, substance use services over and over and over again. We transported him to the psych urgent care centers when he was suicidal, the sobering center when he was really drunk, but he got kicked out of there. We got him arrested for assaulting an EMT, again, just trying to kind of steer him into care. And finally, one of our nurse practitioners, Paul, on the right there, who also works at LA General, spotted him at LA General and got him at the right moment and got him connected with substance use treatment, and he accepted it. And he went to sober living, and he has now been sober for 1.5 years.
Right.
Awesome.
And he's working, and he's housed, and he's saying he's going to go to India to get a wife. I don't know if that's
For being sober.
yeah. Well, it's his job. He works in a liquor store. But he has stayed sober. He has stayed sober. So, and so he called us because we gave him our cell phone number to call us before he called. Don't call 911, call us. We'll come over and see what you need. He called us one day to say, I just want to say thank you.
Oh.
And when they told me, I said, go find him and take a picture with him and see if he'll allow us to use the picture. And the answer was yes.
Oh.
And we have other success stories. Our paramedics do not have the time to do this. This is something that our specialty unit has to do. Specialty unit also triages patients to psych urgent care centers instead of the emergency department. So from this area, we use the psych urgent care center at MLK, and we use the one at Harbor UCLA, the Exodus centers. They do an outstanding job. We need more of them. We need more beds because they fill up.
No.
Okay, last one. We're working on this currently. This is what got me the invitation to come speak with you. So I left it as a grant finale. And we haven't launched it yet, but we're hopefully getting close. And that is, what about patients? So we focus a lot of attention on the low acuity patients because they're the ones that are really driving the rise in our call volume. So things like the advanced practitioner unit are really, really helpful for that. But we're also not forgetting the fact that we really are here for the high acuity patients, the ones that are going to die without us. And so we go to conferences, we talk to our colleagues, we find out what others are doing around the country, and we try to steal best practice. And my colleagues across the country, we freely share everything. So not really stealing it. But one of the great things that's been going on is pre-hospital blood transfusion for patients that have life-threatening trauma or postpartum hemorrhage. So with Chief Maroney sort of telling me that he wanted me to focus on this, I finally said, okay, let's figure this out. It was about 1.5 years ago to get to this point. Can you forward me? Thank you. Maybe. Oh, there we go. Okay. So it's just a news article I picked, but this is technology and stuff that was developed for the military. Military, particularly in the setting of trauma, develops a lot of good innovative concepts and equipment that eventually make their way into the EMS setting. San Antonio was the first in about 2018 to launch a pre-hospital blood program where they actually bring blood in the field for patients that are in hemorrhagic shock. They will then transfuse those patients. They use low titer O positive whole blood. That is a whole other conversation about why, but we agree with them. And so we began the work at that point to bring it to California. California, as you guys know, is a hyper-regulated state in pretty much every possible way, including EMS. It has taken us about a year and a half to get to the point where we are now, which we got funding from the Quality and Productivity Commission to purchase the equipment we need. We have a research partner at Harbor UCLA with the Lundquist Institute and Harbor's Department of Emergency Medicine, Trauma, OB, and Blood Bank. And with the EMS agency, we're planning to launch a pilot in April, fingers crossed, in our battalions 27 and 18, which is Inglewood. It's pretty much the same as the advanced practitioner. Inglewood, Hawthorne, Lawndale, Gardena, Lenox, and Willowbrook, and Carson, where we will put blood on those units and have them administer it to patients in hemorrhagic shock in the field, and then transport those patients primarily to Harbor, although some will go to other centers around the system. And there is a delicate dance that has to be done to acquire the blood, hold it, store it properly, have it available for the paramedics. If they don't use it, return it back to the supplier while it still has at least 2 weeks of shelf life left, so that they can redistribute it primarily to Harbor. So Harbor will use it before it expires, so we can minimize wasted blood. In doing that, the research on this, so we're not the first big city looking at this. San Antonio, New Orleans, Philadelphia, Washington, DC, Seattle, but California has been virtually dark when it comes to this. There is one city that is now live as part of our collaborative, and that is the city of Corona. Corona is much smaller. So far, they've been live for about 2 months. They have not given a unit of blood yet. We are much bigger than they are, and we hope to develop what that dance looks like so we can scale across the system. But it is going to take us time. We anticipate our forecasting is about 40 to 50 patients a year. Oh, and I left out Compton is also partnering with us. So
Doing Willowbrook, you're doing Compton.
yeah, but Compton isn't us. Compton is Compton Fire Department. So, but they're partnering with us because their medical director also from Harbor. So she's coordinating the Harbor side for us too. We are hoping to go live in April. I've set a tentative go live date of April 1st, knock on wood. But there's still a bunch of speed bumps that could get in the way for that, but we're plodding forward towards that. And then we will probably also start in one of the 3 battalions and do a staggered start, just so that our blood supplier gets comfortable with the fact that we can handle the blood safely before they give us 20 units of blood that we potentially waste. So probably we'll start in one of the battalions, most likely battalion 18, which is Gardena, Lawndale, and Hawthorne, because that will be where our hub is for the hub and spoke for the blood. Because it's kind of in the middle between Carson to one side and Inglewood to the other. And so I anticipate we'll probably start there and then branch out from there. But we have a lot of work yet.
Would you anticipate doing this in the field for gunshot wounds like
Yes.
USWs? Okay.
Yep, gunshot wound, penetrating trauma is the most likely, gunshot and stabbing. Blunt trauma like motor vehicle accidents as well. If you look at the Office of Traffic Safety, majority of motor vehicle accident fatalities have vital signs and are alive when EMS arrives. So this is also, we're looking for funding from the Office of Traffic Safety to help us expand. We got denied last year, but the Harbor folks are in the process of reapplying right now. We hope to use that to expand and scale.
And how are you gonna keep the blood? It's cool enough to.
I actually have a demo fridge in my truck right now, but I didn't bring because it's heavy. But it's actually very small. And it communicates, so it is a fully certified blood refrigerator that holds up to 6 units of blood. It communicates its temperature via Bluetooth or to the cloud if you buy the extension, the cellular component, which we're buying. So that I can monitor it literally from my desk. I can pull up all the units of blood we have and what their current temperature is.
And what's the power source?
It has either you can wire it to a vehicle battery, AC power, or run on a regular battery. The battery that it has lasts up to 90 hours. Wow. Had to be able to survive getting into northern Afghanistan with no shore power. So, and then back without wasting the blood. So they developed a really great product. It's not cheap. So we're very thankful to QPC because it costs all in about 14,000 each.
Wow. Just for that.
Just for that. And the unit of blood costs $550. The warmer, because we have to warm the blood too, is not cheap. So all this stuff does cost quite a bit of money, but knowing that traumatic full arrest patients or traumatic shock patients skew younger too. They have generally a lot of life ahead of them and tend to skew younger with fewer medical problems, meaning that they're potentially very salvageable. So, and then the research out of New Orleans says that we will not exhaust our blood supply because what we're really doing is not giving more blood, we're just giving the blood early. So the early research is still pretty preliminary, said that they weren't really using more blood than they were when they were transporting the patients, they were just giving it soon.
Okay, thank you, Doc.
Okay, I know I went over and I'm sorry.
That's okay for the sake of, we're
Yeah.
we're not gonna take questions right now, but if you'd like to talk later, we're gonna go ahead and we're gonna move on with our agenda.
Yes, I'm just gonna put my email up there if that's all right.
There you go.
Please feel free to reach out to me with questions. I know I just gave 7 presentations in my. So I can go,
You tell how passionate you are.
and I'm happy to go into depth with any of you guys who'd like, and especially in the cities where this is going to be involved. And obviously, we share all of our work with all the other cities that don't use county fire. It is not proprietary, it is open source.
Guardian, I appreciate you.
Thank you.
Okay. Oh, thank you, Doctor. Jackie?
Okay, well, this turns out to be our medical evening. Because our next presentation is, there's going to be major improvements and renovations at the Harbor UCLA campus. And they did present at one of our committees and we thought it would be interesting. Thank you so much for you to see what they're doing. So we have Scott Donahue. Is he here or is he?
I'm right here.
Oh,
Sorry.
I didn't see you.
While you were talking,
Okay, so he will be speaking about what's going on at Harbor UCLA. Thank you, Scott.
I was noting the same thing about emergency services. You've all heard a lot about emergency services so far tonight and a fair amount about Harbor. You're about to hear a whole lot more about Harbor. Here we go. So my name is Scott Donahue. I'm the Community Outreach Coordinator for Public Works, specifically tasked with the Harbor UCLA Replacement Program. Just want to just point out a Pamela Manning.
Yeah.
Long time no see, Pamela. Good to see you.
Hi, Pamela.
So just want to point out a couple of, and one quick thing, our project manager, Jillian Teedy, is here. She also works with Public Works.
Hi, Al.
She'll be here to answer any questions that I might not be able to answer. So
Thanks for having us.
just kind of observe me on this. So what I want you to leave with from this presentation is just a couple of 3 basic points about the Harbor UCLA replacement program. First of all, it's a $1.7 billion investment into healthcare for the county. We got started 2019, and then we started major construction in 2020 and 2021. So we're still a little bit into this. Our construction schedule is looking to end in about 2027 and then final move in 2028. So we are smack in the middle of our construction schedule right now.
Are you on target?
We are, yes. It's the largest capital improvement program delivered by the county to date. And basically the whole point here is to reestablish and fortify the Harbor UCLA Medical Center as a center for excellence, research, teaching hospital, all of the stuff that it does incredibly well right now, including being a level 1 trauma center. We'll get into more details on all of that. So the program team starts with LA County. Supervisor District 2 overlaps with it, and Holly, Supervisor Mitchell has been one of our biggest champions on this. We also have the Chief Executive Office for LA County. Below that, Department of Health Services and Department of Mental Health, and then Public Works to actually execute the program. Construct 6 new buildings. So that's the whole purpose. That's basically what the entire design build is about. It's going to be 6 brand new buildings, 2 of which are already completed, and I'll go into that later. Contemporary facilities to deliver the best available care. One of the big things that we're also looking for is to comply with Senate Bill 1953. It's mandate for minimum seismic safety standards, which some of the older buildings on campus unfortunately don't quite live up to. And then The whole point now as well is to complete the program prior to the 2028 Summer Olympics so that it can be utilized during that time. I'm here to help out with the community engagement part of it. Some of it is building community consensus, but mostly I like to try to communicate this to the cities that are actually going to be able to enjoy this resource once it's done. We are pretty much smack in the middle of the South Bay. Service area goes as far as I-10 and goes all the way to the county line with Orange County. Something like 3 million people within the service area. It's also the only level 1 trauma center south of the 10 in LA County. Everything else is on the northern side of the county.
Question?
Yes.
How many buildings are there now and are they getting demoed or are they going to remain?
I don't know the exact number. There were a number of buildings that were demoed, and I'll actually get into that when we get into the history. There is a large 8-story hospital in addition to a surgery emergency center that's immediately adjacent to it that was built much later. There are also dozens of smaller buildings that are used for outpatient clinics, plus the Lundquist Center has a couple of buildings on the campus as well. Some of the older buildings have already been demolished to make way for these new buildings, though.
Yeah, so to answer your question about the existing hospital building, I feel like that's probably where you might be going. The county at this point has not made a decision on the future for that building, whether it is repurposed for, you know, a different facility of some kind, or whether it's going to be demolished. But primarily all of the smaller buildings, which right now house outpatient services, are being demolished as part of the program. So you'll see, I think you have a site map in here that you may see some of those existing buildings, but those are circa 1940s typically.
Yep. The one big thing I also want to note on this slide too, we have a goal of hiring local. It has to do with the CWA for the county. To date, nearly 50% of our workforce comes from local community, 20%, and 20% of that work is being performed by apprentices. So at this moment, we are exceeding our goals, but we are still working towards some of the more higher goals and everything, but we're also pretty close to our peak in terms of our workforce right now as well. Yeah, I mentioned this. So the medical center, just a little bit of background here. I already mentioned the level 1 trauma center, but the medical center itself actually trains 540 physician residents in 54 residency training programs. It's also home to about 4,300 employees, including 3,400 permanent employees. The one big thing I want to note here is the hospital is still operational while we were doing all of this construction. We have pedestrian wayfinding as well as vehicle wayfinding. Also, one of the buildings that we've opened fully for construction is a brand new parking structure, which has been a huge benefit for the medical center. We added 1,500 spaces to it. All right, Camp Ross, 1940s. Medical center is basically dates all the way back to the Second World War. This medical center training area saw something like 300,000 GIs on their way to the Pacific Theater. So a lot of the buildings that are still on the campus existed all the way back then. They're still being used as outpatient. We have demolished some of them just to make way for the new buildings. And I think slowly but surely over the coming years, a lot of them will be gone. A little fun fact, the current hospital was built in the 50s. I think it officially opened in 1961, but the outer facade was used as basically the setting for a popular 1972 to 1977 television series called Emergency. Unfortunately, the main entrance no longer looks like it did in the series. It was completely refurbished in the 90s and 2000s.
You can still go to the station on 223rd Street. It looks just the same in the front. So feel right at home.
So the campus is 72 acres, runs east-west from Vermont Avenue to Normandy, Carson Street in the north, and 220th in the south. It's part of a small chunk of unincorporated territory between Carson and Torrance. The area that's highlighted is our primary construction area. It's where all the new buildings are going to go. We have a new clinic building, a hospital building, and I'll go into details on all of those. We've also constructed some areas outside of that. We have a brand new utility plant down at the southwest portion over by 220th and Normandy. We've constructed an interim helipad on 220th Street as well that the hospital uses while we're doing their construction. Just look at the schedule of the 4 buildings that we still have to construct. We are in construction with all of them as of, I would say, probably December. The last of those was the central utility plant. It's basically going to be the new utility hub for the hospital. We've been in construction on the clinic building for quite a while. It's the one that's furthest along, and I'll go into detail on all of these in just a minute. The hospital building, the flagship, it's the biggest one. It's also going to be the last one to be constructed. We're looking at about Q3 of 2027 to complete construction, and then another 6 months or so to move it and get it ready. So we'll start with the hospital. It's going to be 9 stories, about 560,000 square feet, 347 single occupancy state of the art patient beds, including a nice little breakdown there. I also want to note that the hospital will be integrated into the existing surgery and emergency building. That is up to seismic standards and everything like that. We actually have a nice little bridge together. Here's a look at our current construction. Spent a good chunk of last year digging out the foundation for it. In November, we spent 2 consecutive weekends pouring the actual concrete foundation for it and starting up with the basement walls. And as you can see in these pictures, we're starting with structural steel. One of the big milestones that we're actually planning for this year is our topping out ceremony for the hospital building. That should happen in a couple of months. Steel workers tend to work pretty quickly. Clinic building, it's going to be 6 stories, 374,000 square feet. Purpose here is to consolidate most of the existing, or I should say all of the existing outpatient clinics on campus into a single building. First 3 floors are going to be primarily multi-care, specialty care clinics, imaging, rehabilitation, all the stuff that I've written up there. Top 3 floors are going to be primarily for teaching, as well as for office space for the more some permanent physicians as well as admin. Here's a look at our construction thus far. It's the building that's furthest along, at least in terms of the ones that are still under construction. Starting to work on the interior. We finished out structural steel beginning of 2023, almost a year ago. So since then, they've just been building out the outer facade. You can see a lot of the decorative aspects of it on the outside too, on those top floors. The lab building, it's going to be a 2-story, 29,000 square foot building. Has a full service testing facility to support the campus. Also want to note that this is also a regional lab, which will accept testing samples from all over the county, or at the very least, all over the South Bay. This is also going to house the Sheriff's Department substation. The sheriff, LA County sheriffs do have a presence on the campus. This will just be a more permanent HQ for them once it opens. This one's actually one of my favorite buildings to talk about just because of how quickly we've moved things along. We broke ground on it in September of 2024. We topped out with steel just before Thanksgiving 2024. And it looks like that as of 2 days ago. So we're starting to put together the decking. Probably in the next couple of months, we'll start seeing some of the outer facade going in. They moved very quickly on this building. This is one of the 2 buildings that's currently open. It was the first one we completed, but it was the second one we broke ground on. It's our support services building. Basically houses all of the IT as well as just the departmental support. Serves as a data center for the campus. And in the event of a major emergency, it's also the disaster operational center. 2 stories, about 25,000 square feet. At this point, it's been It's been inhabited, I want to say about 18 months or so. And then the parking structure, which I mentioned earlier, at this point, it's the most tangible benefit that we've actually given to the community. Prior to this, there was only a 2-story parking structure there, and you either had to rely on getting very, very lucky or parking in the local neighborhood. Now, that's not really necessary. We've added 1,500 spots. It's going to, when all is said and done, it'll include about 350 electrical vehicle charging stations as well. So, but yeah, so far, this is where we are with it. Be happy to come back in 6 months or so to give you another construction update. Won't have to go through some of the nitty-gritty on the introductions, but we can certainly go through some pictures. And frankly, if you guys want a tour, happy to help as well with that. You can reach out to me through any of these means. Both the email address and the phone number go directly to me. And then you can get some more information by following the QR code or the website.
Thank you, Scott.
Yep. Do we have any other questions?
Quick ones?
Brief question, and it has nothing to do with the construction. It's just more transport to when trauma patients go to Harbor UCLA as opposed to Florence or Little Company in our region. What governs that transport to UCLA Harbor, which seems to be the predominant one, particularly for some.
So Harbor being a level 1 trauma center, there is a focus on that. I think other than that, I think it's mostly due to proximity. So if somebody is in really bad shape, and I'm unfortunately not wholly qualified to talk about the status of patients, but if somebody is in really bad shape and they're near enough to Harbor, end up there. And they utilize that helistop that we built.
Thank you.
I think most of our law enforcement, if they get hurt, that's where they go.
Yes, that's true too.
What type of testing of specimens that you're going to get countywide, and what type of testing does that include?
I mean, it would just be medical testing, so blood testing.
For patients that are in the hospital
Yeah,
or?
for medical patients.
So it's not an experimental testing or research testing?
Not as far as I know.
Okay.
Thank you, Scott. Tour sounds like something we might look into.
Yeah,
Are interested in tour,
If anybody's.
we can arrange it, so let me know.
absolutely. We'd love to have you. Rainy season's coming up, so wait a little bit.
We get it right.
Don't tease.
But I also want to note that even if you don't have PPE, I can still give you a pretty decent tour utilizing the parking structure. At the moment, it's the tallest building in the construction area. You can literally see everything. That being said, once all the steel goes up for the hospital building, that may cut into the sideline a little bit.
Okay. Well, thank you, Scott.
Thank you, everybody. Thank you.
Look forward to future progress.
Yeah, I'll arrange it with David. Thank you. Have a good night.
Thank you.
Thank you.
Our next speaker is Kim, who's going to tell you about the latest on projects for the South Bay Environmental Services Center.
Yeah, so right now I actually don't have a lot to share with you. It's starting the new year with a lot of our energy programs. We're waiting for LA County to identify they're hiring a consulting firm to help implement all their government programs. So that hasn't happened yet. So as a result of that, they haven't actually released any of their 2025 programs yet, but we are getting ready to, hopefully we'll have information. And we'll be meeting with your facility managers in February. And so we'll be able to roll out the new programs then. So that's what we're hoping. We did work on revising our awards program, our recognition program, and you'll be glad to hear, Gardena, that we have a platinum level for overachievers. And that, of course, recognizes your city staff for innovation and implementing projects, not only like energy projects, but also like your climate action plans, communication with your community, those kinds of projects as well. So I don't have a lot to report tonight, but hopefully next month I will.
Thanks.
I'm going to take the next one, the Housing Trust Feasibility Study. We are getting money from SCAG. And I've mentioned to you to do a feasibility study of whether we should have a housing trust. We have legislation that allows us to, but we don't have enough information as to what that really means. So we have just, at the last meeting, you hired Civic Home. And Civic Home is the organization that is very well steeped in this. They've helped Gateway COG form their housing trust. We had our kickoff meeting, and I'd like you, if you have your agenda, to turn to page 51, or actually 52. 51 starts the minutes of the kickoff meeting, but 52 is what they would like to have an advisory committee. And the advisory committee would meet 4 times in the year. And they actually have laid out the meetings. We're calling it a SPAC, a Strategic Planning Advisory Committee. They were going to call it a steering committee, but I thought that was way too confusing. So we're calling it a SPAC, and they would meet March, May. Let's see, they'd come to our board in June, but then they'd meet again in July and August. And you can see that what they're looking for, and we need the names of interested people by February. They're looking, the meetings would be virtual, they'd be an hour and a half. 3 to 5 city managers, elected officials. They'd like some that represent small cities, some represent large cities, city staff. We're looking for developers, representatives of developers that could help, a lender or 2, and then our legal counsel as needed. I should say that where I am so far is city manager of Rancho Palos Verdes, R. Maranian, Suja Lowenthal from Hermosa Beach, and Clint Osorio from Gardena have agreed to be the city managers. We're looking for different cities, but they also wanted to be supported by their staff. So Randy Forbes from Rancho Palos Verdes, Michael Allen, who helped us with the selection process from El Segundo. Jean Naughton, I haven't checked with yet. I think she's been out and I haven't had a chance. Now I'm having a problem. Greg McLean I didn't write down the name and now I couldn't figure it out. Greg McLean from Gardena, and then Michelle Ramirez from Torrance, which would be great.
Greg McLean from Hawthorne, isn't it?
Hawthorne.
Well, Gardena. He's from Gardena, right?
Greg.
No, Greg McLean's from Hawthorne.
Greg Sujuji.
Okay, I wrote down Greg McLean. I'm sorry. Yeah, I know. He used to be with Hawthorne. I mean, the Gardena. If you've been here, if you've been around too long, like. Okay, and so we're looking for a mix of cities again. We have 1 elected official. The steering committee, Bill Uphoff, did volunteer. But I need a couple more elected officials to volunteer. So is there anyone here that would like these? Are, as I said, they're going to be virtual meetings, and there's 4 of them in the year. And they need to advise the consultant on what you think is the proper organization, something that you know that your city would be interested in joining. Any volunteers here today?
Yeah.
You? Anybody else? I'll jump once. Your hand isn't up, is it? No, just.
Don't hold your.
No, I meant.
I will definitely probably send something out because that's only 2 of you and we really want some elected officials to be
And
involved.
Hermosa raised his hand?
How about a former elected?
You want Stacy?
Yes, this is her brainchild, right? She,
Yeah, I don't know it and she has some development.
yes, and
I don't know how you feel about that. You guys have to decide. Stacy Armato is the one that was very involved in this and she's no longer on the city. Would you like her to be a
She
representative?
wouldn't be bad as a outside, as somebody that knows the
Okay.
program from the outside in that started this.
Yeah.
thing.
Ray, I think I have her email, but can you send me her email?
yes, ma'am.
Great, and I will ask her. So that would, and then we can get started on the committee and you'll get reports. I mean, it says here when they're gonna come back to the board. I'll give you reports every month as to what I think is happening. And we'll see what happens. And as you know, the new Measure A funding has money for La Casa, which is the Regional Housing Trust. That Regional Housing Trust will probably provide seed money for a housing trust if we have such a thing. So now's the time for us to figure this out.
Do you know the dates? The dates in March and the dates in May?
No, I mean, I think they'll probably ask the committee members. Would you be interested?
Depends. The dates, March and May are packed.
Okay. I'll put you down as a maybe, but I think the concern we have is, we have 1 Torrance person, but looking, well, I guess Gardina's got different, we're looking for different economics, you know, different See, well, we'll talk to the consultant about it and see what he thinks.
Okay.
I wanted to make sure, and you can, these are the tasks that they're gonna talk about. You might want to look through that. So next is going to be Ronson, and with this, we also have the item that we added to the agenda, which is the letter that we want to set this meeting.
So off really quick with a update, annual update on our client aid funds. We use Measure H funds to provide like security deposits, help people with moving costs, patient fees. And this is the spread of the cities and communities that we've helped through the client aid funds. So you can see it's a pretty well spread, widely used intervention. 4% going to Carson, we have 15% going to Inglewood. And then Redondo Beach and Torrance, their shelters, we kind of have some concentration there. So wanted to just provide that update for you all. We had a La Casa meeting as Jackie alluded to. John Marish was reelected as our representative on La Casa this week. So thank you all for attending and voting on that. For those who showed up. The meeting also was on Wednesday, and we had a presentation by Ryan Johnson, the CEO of La Casa, who we hope to invite to speak at the COG in the near future. But we talked about key positions that need to be filled at La Casa, including a CFO, an HR person, chief of staff. And then, La Casa is under a very tight timeline to program Measure A funding, which will start being collected by the county in April, and then we'll have to program that out starting the next fiscal year. So that was the discussion at the cost of this past meeting. Also happening this week is the county announced the draft formula for local solutions fund for Measure A. So as you remember, Measure A was increasing your sales tax by another 0.25%. So right now it's a half cent sales tax, replacing Measure H. And this local solutions part of Measure A is part of the non-La Casa side of it. So this is legacy Measure H money. And out of the legacy Measure H money, the county is carving out $100 million to be, it's 97 to be exact, $97 million to be distributed amongst all 88 cities and unincorporated areas. And they came up with 6 scenarios to do this. The first scenario, which they're calling the baseline scenario, is based entirely off the point in time count.
You might want to mention what we get today.
Oh, yeah. So we get $2.2 million today to be split amongst 15 cities, and also use some of that funding for our unincorporated areas, as well as our portion of LA City. So it's not a lot of money to split amongst 15 cities and all those territories. And then right now we're kind of landing, obviously, is the $3 million. But what we like about the $3 million scenario 4 is that it takes into account ACS, which is a proxy for low income families. And so it combines
ACS do?
American Community Survey by the US Census. Yeah. And so that takes that into account. And based off that, we would get more money than the baseline scenario by 26%. So it's a huge boost to us. It doesn't really affect the other areas that much. So it doesn't hurt anyone necessarily, but we do get more money on that. So we're leaning towards favoring scenario 4. We had a discussion with the other.
What you just started with scenario 1 and now you're jumping to 4.
Oh, yeah. So 2 is just based off. So scenario 1 is based off the average of the 23-24 pit count. Scenario 2 is just based off of the 2024 pit count.
Everybody knows what the pit count is.
The homeless count.
Start with like number 1 and then go down rather than start with 4.
Yeah. So number 1, the baseline is an average of the 2023-2024 homeless counts. So they're taking a multi-year average. Scenario 2 is only taking the most recent homeless count, 2024 homeless count. Scenario 3 is using the multi-year average and then setting aside some funds, an incentive fund. And they haven't defined how they would distribute the incentive fund. So they would set aside 10% of the money to go towards cities or regions that And whatever that incentive is, whether they're doing more or they're lowering their count, whatever that is.
I think isn't it because if they just go off the count, if you do better, then you'll get less money. Right? Isn't that part of the why they want to have an incentive of some sort?
But they haven't defined it yet. It could also be if you're building more low-income housing or something like that. So they haven't really defined that. Scenario 4 is a combination, like I said, the PIT count, the multi-year average, plus this family poverty measure. Scenario 5 and 6 is a mix. So scenario 5 is the PIT count mixed in with RENA goals, RENA targets. And then scenario 6 is taking into account the family measure, the PIT count, and also the RENA targets. Yeah, so lots to digest. We did some initial, the San Gabriel Valley COG did some initial analysis. By the way, this all was released last night. So this is just fresh off the press.
Up somewhere that we could access to.
Yeah, and I.
County just released it yesterday.
But where is it located in written form?
It came from the county and.
It's on their website and we can send that out and you can take a look at it, but there's a whole presentation, there's a video, and then they have the list of how the formula measures out.
I did send out 2 webinars for this week to all of you to say if you can, and it was the county webinars and this is results of the county webinar.
Yeah.
Okay, but if you didn't attend the webinar.
Right, no.
Have it written up somewhere.
Mhm.
And who's going to decide on this option?
The board of supervisors.
Supervisor?
Yeah. Mhm.
Yeah, isn't it going first to the Blue Ribbon Commission?
That's why we're showing you tonight.
Okay, so is that the same as the executive committee that's discussed on this letter?
Yeah.
Okay.
Yeah. So our letter doesn't talk about these scenarios because obviously we didn't know about it when we drafted the letter. So we're talking to the other COGs about doing another letter. So you might see that in the future, but to support one of these scenarios.
I think it's fair to say the meeting tomorrow, they have a long schedule for the executive committee to make this decision. Meeting tomorrow is not a decision meeting, but we think it's really important to present what we knew at the time. And that's why it isn't that important that this be included, because we want to let them know over and over how we feel cities should have more money and whatever. So we're going to use tomorrow to do that. And now we're honing down. Next week, I'm meeting with the other executive directors to talk about, looks like scenario 4 is probably good for all of us with maybe some tweaks. So we're going to try and make it united. And the other thing, Constance, I think you ought to say is, if you change the formula, somebody's got to get hurt. And so you say it's not going to hurt anyone very much. I think you told me that the city of LA gets a slight reduction, and so does the county, I guess. I mean, the money has to come from somewhere.
Well, just on a percentage basis. So like if they were to choose scenario 1, we would be hurt by like 26%. And then LA City would get 5% more, 6%.
And that's what their default was at the beginning.
Yeah. And so, but if they chose scenario 4, we would get 26% more money, but LA City will only lose 5%. So it's like the impact isn't as large for LA City because they're so big.
Right.
And so a slight tweak in the formula impacts us smaller cities a lot more. Yeah.
I think one of the issues I was hearing a lot when I was going over the draft before it became Measure A and had all kinds of stuff in it, and the LA division was getting it. There was this wanting to go to point of time scenario for homelessness. Well, LA City always wins on that because they were saying, come on down, set up your tents and we won't do anything. No, I'm just saying, I mean, you go to Echo Park, I'm like, what happened here, And so that's what that is, that makes it them get more money only because they weren't doing any real enforcement and saying, hey, you guys can't stay here. You need to go to, a shelter, you need to do this, whatever. So all I'm saying is we cannot have some scenario that basically validates or rewards bad behavior, in my view. That was not very, it needs to be helpful for the homeless people and for the people living in the community. There wasn't any of that going on. It was.
Yeah, and we brought that up in the meeting yesterday. We're like, is there a formula that you considered that would reward cities for performance or anything like that, or the number of shelter beds? They didn't come up with an analysis based on that, but they they did say like, we can come up with a formula and propose it if we wanted to. That would be a lot of work because then I would have to figure out how many shelter beds are in every region and locale but something we could look into.
Well, all I'm saying is that I think the point in time was not, that I heard a lot of statements that that was not fair. And at the beginning, they wanted to give 60% of the local solutions fund to LA City.
Yes,
60.
yeah.
I'm just saying, I'm like, no.
Right now, they're close to that number.
Well,
Based on
yeah.
all the scenarios, yeah.
Right, but they also have other sources of money within LA City. too.
Yes,
So that's they are very, they have a lot of tax.
yeah, more resources.
Yes.
Yeah.
So this is our letter, pretty much, right?
Yeah, so the key takeaways are, if scenario 4 is chosen, we would get, instead of 2.2 million, we get $3 million, so something. We are planning possibly a joint letter again. Right now, it sounds like scenario 4 is in our interest. So one thing, the way the county did it is they kind of looked at all the cities and they kind of divided it by cities under 100,000 people in population. And they looked at cities over 100,000 people in population and then cities over 300,000 people in population. And so at the 100,000 people and less bracket, there's only 2 cities in our region that's more than 100,000, it's Inglewood and Torrance. Everyone else is under the 100,000 bracket. So there's also 73 other cities in that bracket. And right now, the way the funding formula is looking, only $12 to $14 million of the Measure A services budget is going to 73 cities. So that's only 3% of the Measure A services money. So again, we're not getting a lot of direct returns for the amount of money our constituents are paying into Measure A. So that's a concern of ours.
Right.
We brought this up also, and the county suggested that we find other areas to cut so we can get more money. And so we've offered a couple of options, including right now in their budget, they're planning on $97 million being spent on administrative costs at LAHSA and the county with an average. And you see in the letter, the average FTE cost is $288,000. And that's just from their presentation. We've identified also an additional $87 million. Those are the programs I've listed in the letter that they could not necessarily cut, but have us administer those programs better. So for example, time limited subsidies, these are rental subsidies we give to our landlords. We're getting a lot of pushback from our landlords that those rental subsidy payments aren't being timely. And also what the county does is they step down the payments. They expect the clients to kind of step up and be more self-sufficient over time. But what's happening is LAHSA is stepping down too quickly before the client's ready to take over more of the rent. And so the landlords are left holding the bag. And so a lot of landlords feel burned by that program. And so I'm now undertaking this re-education program about TLS and how I'm going to do TLS and how our TLS is going to be better. But anyways, it's like work like that, but I think we can do better as a region. And so we've identified $87 million where they can give to us instead of having LAHSA spend it. And so that's basically the basis of the letter. The third point we make in the letter is about data and accountability. That's something we've been harping on forever. So we'd love to have your support to send this letter to ECRA in tomorrow's meeting.
So moved.
I'll second.
Yeah, second.
I have a motion and a second. Roll call.
President, Segundo, President Garcia,
Yes.
Hawthorne,
Aye.
Mosa,
Yes.
Inglewood,
Aye.
Is she that? Where is she voted?
Aye.
Wanda,
Yes.
Lamita,
Yes.
LA City is not present, Manhattan Beach,
Yes.
Los Verdes Estates,
Yes.
Rancho Los Verdes not here, on the beach, not here, Rolling Hills.
You're talking to me. I know, he's talking to me. Yes. I was trying to say, I have to listen.
Rolling Hills safe,
Yes.
Warren not present, Steve Chu is not here, and that's Deschel.
Abstain.
We need to put a cap.
Thank you.
She's gone.
Just some 2 quick updates. Homeless count is postponed to February 20th. So on February 20th, our cities are conducting the homelessness count. I already saw some cities like Torrance having flyers out asking people to volunteer for the homeless count. the point in time count, which is now being used for the funding. And then the senior services working group, we're meeting on the 28th. We're going to talk about the Torrance Senior Program. And then we're kind of doing a survey to kind of assess what we wanted to accomplish in this coming year. So that's what's going to happen in the senior services working group this month.
So do you actually want to participate in it?
No, there's like a webinar. It's like an hour long. It's not a big lift. Yeah. It just tells you like who to count, what to look out for, things like that.
Quick question for you, Jackie. Where do we actually have any leverage with regard to the Measure A funding considerations and the structuring of this board? Is it through our representative?
We, tomorrow with the executive committee, Paige from Redondo Beach, and I'm sorry, I never want to even try her name. She works very closely with Ronson. So she is going to present our thoughts as well as the other COG representatives. So there's one from Gateway, there's one from San Gabriel Valley. We also talk with Supervisor Barger has been very open to our office and to Ronson. And obviously we're going to talk to Supervisor Mitchell and Supervisor Hahn. But it's going to be a big push. I mean, there's no question about it. Mayor Bass sits on that board and, you know, she's going to be strong. So but I think that's why, I mean, Gateway, Hector Della Torre, who's a former assembly member, is the executive director of Gateway. And he is really hot under the collar about this and wants us all to make sure we work together to just keep pounding and pounding and pounding.
Because I see why we need to submit a letter, but just in terms of real politics.
Right.
Questioning how impactful this really is compared to.
Yeah, that's a good question.
Yeah, no, you're right.
I don't know how.
And Ronson and I had a discussion about the fact that they know where we stand. But I think we need to be on record. We need to have letters. We need to be out there talking so that they know that, you know, we're a loud voice.
Okay, second question for you, Ronson, in terms of the rescheduled homeless count, remind me the numbers from last count, those were not released?
No, they were released. They just, what they did was they stopped weighing, they stopped extrapolating the count based off of the formula for the cities. So remember that was always like this big.
What's the expectation with this count is why I'm asking.
Yeah.
That these numbers that are going to be able to be publicized.
Yeah, they're gonna probably do the raw count numbers again. So I think they're transitioning away from the extrapolation to just publishing the raw count.
Thank you.
They're gonna have to do, if they're gonna make big formulas off of it, they're gonna have to have a pretty account they can use. Yeah.
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 And Bronze, did they fix the problem? Remember last year when people were reporting those numbers, there was like a confusion.
You mean the night of the count?
Yeah, the night of.
Oh, the technical problem?
Yeah, the technical. problem I had.
We'll see. There's already some problems with the signups. There's always yeah.
And I think there's some concern, just so you know, for the incentive funds, because I know Rex in Long Beach as well, all over that, because he wants to get a lot of money for Long Beach, because they have made a lot of housing, and so they want to say, link that to more money for Long Beach. Because he was very vocal during the drafting of Measure A.
Yeah, I want to stay away from like us fighting for a small piece of the pie.
I understand.
I want to increase the size of the pie.
The fight, I mean, unfortunately, I know the fix for La Casa, it cannot go any lower than a certain percentage. And that's written in there, but there's nothing for the local solutions fund. So that is something that absolutely needs to be increased, but it doesn't have the protections that La Casa had for their fund.
Okay, thank you very much.
For those of you that are looking at the agenda, you can see that I messed up. And we're supposed to be talking about office space now or before. So let's go on to office space. And I just want to first draw your attention to the air conditioning.
What? I can't hear you, Jackie. Can you speak up a little?
So they came in and I think they did a pretty good job. It hasn't.
They worked on it.
Yeah.
Oh, it is better.
It's better.
So deafening, yeah.
Yeah.
So that's pretty good. But I'm gonna who is doing this? David?
David.
Yeah.
Yeah, David's.
And this is on page what?
57.
57?
Memo that was submitted to the steering committee. We. Our lease is up here in June, the start of that. In the last several months, we've been exploring new potential new sites. Some of the issues that we found with this one, AC noise was one of them. We've grown staffing size since we moved in here. We moved in here just before COVID. And we've grown in programs and staff since then. When we're all here for all team meetings, there's not a fight for a table space, but we have to get creative in where everybody sits. And so, and it's on some of our large board meetings in this room, we're pretty full. We have that small conference room at the front of the office that we sometimes set up for an overflow if we need it. We felt that this boardroom is about as small as we could make it operationally at this point. So what we did was looked at new locations.
Can I just say one more thing, which we keep forgetting? Across the driveway is the county's a county building, which has been sold, and the city of Torrance has approved it for a very large housing project, which I did talk to the planning director in Torrance, and it will, within the next 5 years, if we sign a 5-year lease, it will be a construction site. So it will be there. We don't know where the staging will be. So that's just another consideration.
And so we engaged the same real estate agent that we used last time, Thatcher Goodwin with Colliers. And we found a new suite available in the 2377 building, which is right next door to us. That's about 1,500 square feet that could serve as a standalone boardroom if we wanted to expand and take that extra space. What we would do is then tear this one down, create more offices and open space here. So this would be kind of the staff work area. And when we have large meetings, we would use the boardroom on the other side. In your packet on the 59, it looks like, is the kind of the proposed phase plan for that option. The suite 170 off to the side is that standalone boardroom space. Right now, currently, it's kind of where that line is, kind of dividing down the middle. There's some offices along the window line. That wall would be torn down. There's a little tiny, I wouldn't even say kitchenette. There's a sink and a little counter high fridge. You would tear down that wall and kind of make it a counter, so you could we'd put food and this kind of stuff up on that counter as a service area. And then along that left wall would be some storage, cabinetry or shelving. This space here is about 900 square feet, so it's about 600 square feet bigger than where we are now. And then the suite 125 layout on the next to it is what we would intend to do with this space. As you can see, we'd be adding 1, 2, 3 offices along the window, and then one long one back here along the wall. And then this wall along the hallway would come down, and that whole area would be open space for seating. A lot of our Civic Spark fellows, the newer staff, they like to work kind of together in groups and don't really have much desire to have their individual offices.
Bohemians.
So that's kind of option 1 for this space. Option 2 is a whole move to a new location, 357 Van Ness Way, not Avenue, but Van Ness Way in Torrance. It's a little offshoot of Van Ness Avenue. For those that were around when we were at our office on Western, it's pretty close to there. It's just off of Van Ness and Del Amo. The second, right behind the second space diagram is that option. That location altogether is 6,700 square feet compared to this one. If we were to expand here, this one plus the new space would be 5,900 square feet combined. The rent at that other location, based on our kind of initial conversations with the real estate agent and the landlord there, would be $1.55 a square foot compared to $2.60 a square foot here. The main difference in the rental rates is the 357 Van Ness option. They have what is called a CAM, common area maintenance, which covers parking lot maintenance, gardening, trash, that kind of stuff. At this location, it's all included in the rental rate, so it's not separated out. The CAM fluctuates year to year based on expenses, and so what they had agreed to do is cap it for us so that we have a little bit more certainty in what that rate would be year to year. It's averaged 19 cents a square foot over the last couple of years. And I think in the proposal that we would kind of initially start at, we would cap it at 20 cents a square foot. So combined, we'd be looking at about $1.75 or so a square foot. Both options would have some sort of rental discount. At this one, it would be most likely 50% for 7 months or 8 months, and at the Van Ness option, it would be 100% abatement for 4 months. So all in all, it's about the same number of months abated, but it's just kind of different breakdown. The 357 Van Ness option, I have a short video that'll pull up in a second. It's pretty much wide open space right now. It'd have to be built out to our specs. I don't think at this point the landlord has any kind of heartburn with anything we've asked layout wise. It seems to be pretty standard.
Isn't it at both places, the landlord would.
Yes,
make improvements?
right. And we get into the fine details of exactly what they would pay. I mean, we haven't said we're not willing to pay for this yet.
Yeah.
So I think we're pretty good. When we moved here, there were small things that they asked us to pay for, like soundproofing in the walls, things that were kind of above the building standard. But as of today, with kind of the initial proposals that have been going back and forth, both landlords have been okay with the modifications that we've asked for.
And they're gonna fully pay 100% according to what they said?
As of right now, yes. Once we select a location and really do the deep dive into the actual architecture, that's where you kind of get into, if we want a different kind of carpet or different kind of wall treatment, that might be something that is above and beyond the building standard that they would ask us to pay for, but we wouldn't be making any of those decisions without board approval.
We'd bring it to you first.
David, I have a question. I'm sorry. No, go ahead. Just based on the schematic, what would be the proposed size of the boardroom at Van Ness?
Van Ness boardroom would be about 1,200 square feet.
Okay.
It's about 300 square feet bigger than this one. Small, 300 square feet smaller than the standalone one, the other building.
It would have a pool in it, though. It would have a pool.
They all have pools in it.
Both of them,
Even across
in this
the-
one, it's not so easy to see, but behind the wall where that clock is, there's a support column. In both options, there's a column somewhere that you can't move. So it'll be a little awkward in both of them.
They all have.
But that's kind of how we ended up with these little nooks here, is we tried to build around it to maximize space.
Got it.
Yeah.
Well, I was gonna ask you, which one of them is gonna have better access to the bathroom?
The other one does.
The other one does.
They're both the same. The other one, as it is right now, there is a small restroom in the suite, within one of the working spaces. But the main bathroom is in the hallway.
It's right next door.
But
It's
yeah,
You just walk out the
as
door, it's
far.
right there.
not locked.
And it's not locked.
Well.
Yeah,
And we're thinking that we might take the bathroom out of ours because
Yeah.
the bathroom is right next door. We can
Yeah.
Use that for an office.
or like a storage or like a copier room space.
Mhm.
And we can play with this schematic still a little bit, right? It's such an open space. So like if we wanna, I think when they first proposed it, so they have, if you'll see it, like those offices that are like 2, 3, 4 on
Page
the,
60.
you'll see that square footage is like 13 feet, 7 inches. And so we already asked them to move those offices. Don't need to be,
Smaller. so you
yeah,
can-
they don't need to be 13 feet. So they're 10 feet and then that added another, 3 feet along that whole wall into the boardroom.
The 1,200 is with that added fee,
Oh.
right?
I don't,
Two questions.
Here, do it.
How do you pick the location of Torrance versus any one of the 15 cities that are represented here? And number two, did the broker talk about the vacancy rates and better deals that might be available than the 175?
Yes, so I'll answer the second question first. What we get from the broker is a whole booklet of options from throughout the South Bay. And what we do is kind of just, the first cut is just pure square footage. Are any of them the size that we need? And then we kind of look at the rental rates that are included in
Parking opportunity.
parking opportunities and the other kind of amenities. And so I think we looked at probably 30 or more at least. It was interesting, when we first met with him, we had this perception that office space rental rates should be low in the South Bay because of post-COVID, everybody's doing something different. But that's really only true in the downtown, like LA centers. What he found was that folks that used to have offices downtown, who may live in the South Bay, have actually relocated their offices to the South Bay, as opposed to getting rid of offices altogether. So the South Bay market is not nearly as vacant as we have the perception of it being. And the reason we picked Torrance is it's pretty central to geographically for most of the South Bay COG members. And so before we had an office, we used to rotate board meetings, that sort of thing, which is always an option again. But having one go-to location for board meetings kind of erases the opportunity for confusion of where are we going to be this year or this month or whatever.
Yeah, we used
Thank
to go to the chair city for the year that they were chair. But
As we've done hybrid meetings and that, it just gets more complicated.
Yeah.
Finding off-site locations.
and the other thing is the other facility is closer to the freeway, right?
Yeah, it's a little bit closer
It's a
to,
little closer.
yeah, depending on which freeway you're going to, that sort of thing. Yeah, it's a little closer to the 405 and Western off.
But I have to tell you that I like the layout of the Van Ness one.
Yeah, we could show it.
Well, it's hard, you have to have a good imagination if you want to show the video, but we
We
did.
don't have to.
Did you finish?
No, I think the big thing that we need to decide is, or one of the big factors in the equation is we've built the South Bay Fiber Network to this location. To build it to the Van Ness option, it's $400,000 or so,
wow.
based on just the fact that there's no connections to the existing network nearby. So it's a pretty long distance you have to pull the fiber. We do have a little bit of funding left in our Measure M grant that we could apply to that. But at this point, it would likely be somewhere between, I think it was $250,000 to $300,000 or so. From some other funding source to bring the fiber network to the Van Ness option. And so if that was the place that is ultimately the board's decision to move to, what we would most likely recommend is going with another ISP in the near term. And if we can find a funding source to pay for that fiber network connection to our network, we would do that down the road. Right now, we have two initial quotes from, we have one officially from AT&T. It's 2 gigabit service for about $215 a month. It's not quite an apples to apples comparison to what we have here. Our service here is what they call carrier grade, so it's pretty much guaranteed 1 gigabit up and down. At the other location, when you're kind of sharing it, so you're not guaranteed to give 2 gigabit speed.
And it's we pay $1,000.
We pay $1,000 a month.
So we
here.
pay $1,000.
But I also want you to know that the next item I'm gonna discuss is that the fiber network is selling and planning to grow. So over time and working with the new owner, we would talk to them about how we connect back. And it might not be immediately, but as it grows, we might be able to make the connection later. And the South Bay Fiber, we would be nice to be on our own South Bay Fiber network, but it isn't essential for what we do here. So.
Yeah, most of the time, devices today, your computer is really what throttles your speed on your connection. Most computers can't handle 2 gigabit speed anyways, at least the ones that we have. We're not buying that kind of top tier computer. So I think, but I mean, I can't guarantee, but I would imagine that the type of usage we have would be fine with what we'd be able to get from AT&T.
So you want to show the video?
Yeah.
So this, this is Ann was, our staff member Ann was at the last
It's also
walkthrough, took a few video clips. I combined them together into one. We'll try and narrate this as we go in. So where you're looking now is the entrance of the suite. That's right there. That's the front door. There's one office here. And that window right there is essentially the front desk area right now. We would take that down to make it more open, like a lobby. I think that wood or laminate flooring is kind of what would be throughout the unit.
Oh, I thought they put.
No, they
no,
said-
they're gonna.
Oh, did they change that? Oh, okay.
Yeah, they said that with the, none of the flooring samples were.
This would be conference rooms probably there, but then it's this open.
So as you can see, there's this.
I recognize that guy.
It's pretty much wide open, and so this far area over here is where the boardroom would go.
So you have one pole in the boardroom.
And that, this wall right here unfortunately can't move. There's, I think.
Oh, I asked
It's
them
a
that.
load
They have- That one has to be there?
Yeah,
Oh, okay.
there's electrical in it that can't be relocated, and I
Okay.
think it might be partially load bearing.
But we would move the office.
Yeah, we, I
That
think,
wall.
we were gonna build fill in that little space, extend, try to make 3 offices out of that, because they're big offices, like 3 offices out of that. And we would still have an open area, so we can still have staff that like to sit in like an open space.
And there's a little clip of it later on, but this, along this window line, it's kind of like our own little private patio
Terrace.
kind of area,
Little
terrace
terrace.
area. So there's some outdoor space.
You have cocktails over there.
General.
Bars for Henry.
I'm sure, I call.
Where'd you see it?
Yeah.
I think
Happy hour.
this one that's going into now is, I think, where that bathroom is.
And one of the problems that we have is our outreach team is getting so many materials. It's hard. There's not enough space for them to work, and the volunteers go in that space. And this would give them, ideally, we'd put them in there, and then this would give more space for all the volunteers to work along with all of the materials that we have.
And so this is at the far end of the room, off to the left area. Where Jackie's standing kind of over in the corner is a little storage area. This would essentially be our kitchen kind of break room.
But why don't you, if you're getting rid of the bathroom, why don't you use the plumbing for kitchen break room? Because you already have plumbing there.
It's all the way on the other side.
Yeah, I think. We would go through that kind of.
The bathroom is, if you go out that door to the left, is where the actual bathroom is. It's that close.
So that whole area that's, I'm at one end of the boardroom.
This door back there is that little storage space.
They're not the greatest videos, but.
So do you guys have a recommendation for us or?
Yeah, what is your preference? You guys are gonna work
You
there.
guys went and look at it, right? And Tanaka was there.
Yes, you can see we had Rodney there and Bill Uphoff came.
Uh-huh.
And so Rodney probably ought to say what you,
Well, so
there's the terrace.
This is that little terrace area.
yeah, my biggest question was, because we're not in this building all the time and staff is there 7 days, 6 days a week, whatever. We had to make sure that, which one did you want? Which one would be more conducive to them doing business? And we also had to think about the boardroom going from here to the next building, which is not a short walk. And that one over there there's a lot of construction that needs to be done to it, but we weren't real comfortable in having staff go to a board meeting in another building. And if you needed things or if something needed to be done, a staff person would have to go from there to here. You know, logistically, it didn't make a lot of sense. This is a blank canvas on Van Ness. So staff, what they were looking at, and they were saying, oh, we could put this here, we can make offices here, we could, you know, so they could actually make it conducive to what.
So they can mold it to the
Yes,
fit.
and there were a lot of things that they were talking about, and the property manager was susceptible to everything that they asked. Oh, yeah, don't worry, we can move this. But it's one of those things where you have to let us know because it's not gonna be like an overnight project. So once you guys decide this plan, then we can build it to what you want. The floors and everything, they said, hey, if you want carpet, we'll put carpet in. And there were just certain things that they said they couldn't do, like Jackie didn't like the ceiling because it was kind of low. It's about an 8.5 foot ceiling. And Ronson didn't like it because they had like 100 sprinkler
Sprinklers.
heads. But they could cover those. There were just
So they're
little
gonna cover
minor
the sprinkler
things.
head.
Yeah,
Well,
it was
if
like,
you're having a fire, you probably need them.
Yeah, but it,
no, they were like right next to each other.
It-
They were
yeah.
like sticking out like by like.
Oh, so
But
Why
they
the building has
would
been
work on that.
subdivided and resub.
company was very, very acceptable to the things that staff was looking at.
And the other thing is this was during the fires And we asked about, well, how are you gonna get a contractor in here? And they do their own.
They have their own
construction. Yeah.
construction people, because we were worried about, well, what about all the construction with the fire areas? You're not gonna have enough materials and people. They said, no, we have our own. And so whatever you need, we can do it in a timely manner.
Jackie,
Parking was good. The lighting was good. They even showed us that, like, when the girls work late at night and they're here by themselves, to get out of the building and get to their car, they could actually park next to an exit. So they would leave the building and go right to their car.
to pick up on a comment back in the room here, what direction are you seeking from tonight? I have my own comment, but I'm just curious, what are you looking for?
If we're gonna do this, we have to make a decision now because there's construction in both, in this site or the other site. So what we were hoping is to get a recommendation to negotiate for one of the
For one of the
spaces,
two, yeah.
so that we can get started. And I should say that even now, there is a possibility, since June is the end of our lease, there's a possibility that we would go telework for July, but we can do that. We've done it before. And then if we had the July board meeting, we could have it at Gardena City Hall or someplace else. So we have to be flexible because we still might not be able
That
to
might be
transition
done
right
in
away.
fast, time.
My own comment is consistent with what everyone has been discussing so far. I think it is important to make sure we have a conducive work environment for your needs of the COG. I would also say for a board meeting, this room has been certainly substandard what I was used to when I served before. I think we need to be able to better accommodate the public, particularly when we have large meetings and speakers, because we are a public-facing organization. And it's been frustrating for me, particularly when we've had large members of the public, to not be able to accommodate them. But I recognize we don't have meetings we have multiple times a month, but I think that's part of our function. So to the extent we have a blank canvas, to the extent we have the budget because of the savings in square footage, and more particularly, we believe there's an opportunity to negotiate TI in a way that can build out the space consistent with our needs. I think I would be in favor of further exploring the Van Ness site.
And Craig, you had your hand up?
I was gonna make a motion.
Well, I have a,
We ready to make a motion before, right? We have decided we already.
I would like to, Alex, can I ask the question? Okay, thank you. Okay, so I would like to know how accurate is this $75,000 for a move from here to there? Because last time you guys said, oh, we're budgeting 100 grand.
Right, and it was
And,
50.
and we
It
only
ended up
spent
being about
50. Yeah,
And so
okay.
we think that, I mean, with cost increases and exactly, so part of what we had to do last time is put stuff in storage. If construction on that new one is done in time, we don't have to store anything, we just move it
Right.
over. When we moved here, we didn't bring along as much furniture. A lot of the furniture we have here can be brought over. And so we think with cost increases over the last 5 years, 75, we didn't think we need 100. But I think 50 would be a little short, probably.
Might be, we're not sure.
And two other things that Kim was saying today, interestingly enough, that we don't have as much paper. We scan everything now. So there's not as many files. And second of all, I asked the city managers, although I got no response, but I didn't ask a definite question. I would go to Torrance or Gardena or someplace and say, do you have a place to store this for us for a month? So we don't have to pay for storage.
Well, could be, yeah, with that. The other thing is in terms of what we're paying now for the South Bay Fiber Network versus to get some other way to do your IT and everything you also use from the fiber network. What's the difference in cost? Because that has to be added in if it's less.
It will be less cost to us
Yeah.
if we move and use another service, but it will not be the same grade of service. So we'll have to see if that works for us. And we would like, and eventually what I'm hoping is the new owner will say, wow, it's wrong for you not to be on our service and hook us up. So we'll see, because if we can get construction going in the South Bay for a new fiber network, we'll put our name on the list.
So Rodney and I had the same idea tonight. We both went by the site on our way over here to see what it would be like. Almost meeting time. And we both.
The parking lot was pretty vacant where our building would be, and it's well lit. It's right close to Van Ness and Delano.
It was vacant yet not dead. So it seemed like it was in the sweet spot there where there'd be lots of parking for our members and for the public. but at the same time, not feel like people would feel uncomfortable there. And
They have a security guard too, I think.
They have a security guard and the building that we would be in, the management company, their office is in the same building.
Oh, yeah, the management company is the same building, which is kind of nice. Yeah.
Okay, could I ask a question for the $75,000, say, and all the other maybe a pertinent cost? Because right now, the cost, let's say 175 per square foot is less than what we're currently paying, right? So if you amortize, I don't know how you would amortize $75,000. Is it over the term of the lease? How would that factor? Because I am not a math witch, but I know there are plenty of them here. They could put that into a number so I could interpret it. Is that still less than what we're paying now?
Yeah, so if we're able to do assuming we have the rental rates that we have in the chart, we would save about 240,000 just in flat rental savings.
And that's over the life.
Over the 5 years.
Over the 5 years.
Okay.
So you'd still subtracting 75, you'd still save $165,000.
And these are, you've gotten some firm figures. They're not just.
In all fairness, we haven't done negotiations. We've just, like, what do you give us? And now we have to sit down with them and say, this is what we want. What are you gonna do? So we'll have to come back to you.
Well, they're pretty firm.
Yeah, I mean,
they're
not final numbers, but they're very
Yeah.
solid numbers.
They're from,
Okay.
working with the
just wanna
broker.
make sure that if they come back different, you don't, we're not.
They come back differently, we can come back to you guys.
And then, they would not be able to give you discount instead of 4 months to 6 months?
Yeah.
You remember the discount rate you said they're gonna give us for 4 months?
Yeah, so that.
And they go like 6 months?
So Van Ness would give us 100, so free rent for 4 months.
4 months.
Yeah.
So we can ask, I mean.
Yeah, just
And
ask.
those are the kinds of things
And
that we.
negotiate.
We would ask for
Yeah,
more.
they ask for more.
Decided tonight to go.
If they don't, just go with the 4.
We give them the authority to negotiate.
Right,
Yes.
that's what we're asking for.
with our broker.
So moved.
I got a motion. Do I have a second?
Second.
Sure, I just.
1 second. Who was the second?
Craig.
Craig.
Okay.
Oh, you want?
Well, for those that don't know, hi.
Craig.
Welcome.
Yeah.
Welcome for those that don't know you.
Thank you.
From PV States.
I
Did she
can
leave?
do it. Yes,
Okay.
Councilmember Falk had to step away so we can
Oh,
go ahead and reverse
okay.
roll calls.
Can I ask a question before you
Sure.
analyze it? Could we move to do this, and if the numbers stay the same, we give you the authority to execute the lease?
We would bring the actual lease.
Yeah, we'd have to bring
back.
those back.
Back.
Yeah, but that would be great if. Thank you. Thank you.
That's what we're basing our decision on, so I hope it doesn't vary.
We're hoping we can maybe get it less, but.
Yeah.
this is-
Yeah, I mean,
We want
yeah, the
better.
same or less.
Yeah, the same or less, obviously, yeah.
Did you
Okay.
vote?
So we've got the motion to move forward with the Van Ness option. Any opposition? Any abstentions?
Go for it.
Thank you very much. We'll give you a progress reports.
Thank you, everybody.
Next item is we've been running around this side of this, the South Bay Fiber Network. Our American Dark Fiber has, as I've mentioned at a previous board meeting, they've done a good job for us. Our fiber has been reliable. It has worked well, but they have not been aggressively marketing it. We would like to do is bring this to small businesses, to the community. And with that, we'll be able to have a much more robust system. It turns out that the South Bay Fiber Network, that the new owner wants to bring in a new kind of service, which would be what's called open access. He would provide a platform in which other companies would ride on the platform. So for example, AT&T, Spectrum, all of them could all have their services and they would compete with each other on our platform. So that you would be able to see good customer service, better pricing, and you could also buy home security on this platform. It's a new way of providing these kinds of services. I am not the expert to talk to you about it. In February's meeting, we are going to have the people to talk. We have somebody here from the team, but we're going to have the people here to talk about what we're going to be proposing and providing. The agreement that we have with American Dark Fiber says that they cannot sell their service, their South Bay Fiber Network without approval from the South Bay COG board. So it has to come back to you next month, and that would be for approval. The reason it's not here now is that our attorney is looking over the agreement, and I'm not going to ask you to approve anything unless I hear from her that we're ready to do that. So we're going to get that information probably at the end of this week. I'm hoping we'll be bringing to the steering committee probably a recommendation and then to the board. So that's what's happening with the fiber network. But I do want to tell you that very exciting, Wally and Jake from our staff have been going to the regional meetings it's called LA Deal. It's with LAEDC, the Economic Development Corporation, and they have formed a group dealing essentially with digital equity. And so we've been going to those meetings, and they came out, they have, I think you might know, they have something called an 88 City Summit that they do every year.
Yep.
Well, this year, the 88 City Summit is in Torrance, and they're doing it on the digital economy. So we contacted them. They said you could propose a speaker or a panel. We proposed a panel to talk about what we're proposing here, which is going to be very different than anything in the Southern California, and possibly even in the entire, I think there's one other in the state that might be trying to do what we're doing right now. It's cutting edge. And so we were accepted, and we're going to have a panel. So it's March 19th at the City of Torrance Cultural Arts Center. And it should be a very good conference. It is the 88 City Summit, and it's on the digital economy. So we're very excited to, and LAEDC contacted me and asked if he could introduce us because he wanted to complement our service. So
When did you say March 19th?
March 19th. So that's that. And then I'm going to go back to David to give a transportation committee.
Oh, wait, did you do seniors?
Yeah, he just mentioned, Brownson just mentioned the seniors.
Oh, okay.
Yeah. So transportation report.
Randy, do Metro first.
Okay.
I'll just do a really quick Metro update.
Mike is here too, I think, somewhere.
She say March.
Yes. Go ahead.
Sure. So today Metro passed a motion in response to the wildfires. We're making low-income fares available to anyone who's been impacted by the fire. So if you've been impacted by the fire, you can get 90 days of a free transit pass, and then you get 20 free rides a month going after that. Doing outreach to the evacuation centers in Pasadena, Westwood. We've also been offering free fares to our entire system the last 2 weeks. We'll go through Sunday, and regular fares will resume on Monday. I learned today 19 Metro employees lost their homes. One in our department did live in Altadena. There's been some modified services with bus lines and rail, nothing that affects the South Bay, however. We've also just been having clearing a lot of debris, being brushed away from the transit lines, deploying energy sources in case power would go out. And we've also been handing out masks on our buses and our trains. I actually learned today the Seattle Transit Agency sent us 13,000 masks. And so we've been handing out masks left and right all over the place. I came to my desk today, there were masks. So it was just a big mass distribution effort underway at Metro. But that's kind of the main way that we're doing it, is just trying to give people who've been impacted the free passes. And actually we have an interactive map on our website that shows where resources are for evacuees and Metro rail lines and bus lines to take you there. Other Metro news quickly, we don't have much time. We have our 25th month in a row of ridership increases. So we're about 1 million weekday boardings now, and our weekend ridership has actually now exceeded our pre-COVID numbers. So the ridership on the system has really increased a lot. I think as a result of our regional connector happening was a huge jump, and then improvements in some of the security and just the distribution of rail lines. For the South Bay specifically, we are going to, for the Sea Line extension to Torrance, we're having a surveying. We'll be starting around February 5th. Between 8 a.m. and 5 p.m. we're having crews go out to be in the right of way, to do surveying, to do traffic counts and things like that. And this is in response to, or as we prepare the FEIR for release in the second half of 2025. I'll also be having drones on the right of way, and no one's going into anybody's private property, anything like that, but they'll be starting in a few weeks. We've had meetings with the city manager in Torrance, Redondo Beach, and Lawndale about all this. And finally, the I-105 construction has started on the Express Lanes project. It started a few weeks ago, and we will be having somebody from our Express Lanes team. There was a lot of questions about Express Lanes at the last meeting about the technical aspects of how they work and you're on the 105, you're going on the 110, we have to pay this, but you see the sign. So we are going to bring out somebody from our express lanes team who can kind of handle the more technical questions about express lanes.
That will be at the Transportation Committee on February 10th at 10:30. And so, and they are going to put express lanes on the 105, so you might want to come and learn more about how it works.
Mike, did you have anything for the board meeting today? You want to report out?
I think you did a great report. You took the words right out of my mouth.
Thanks, Mike.
You have.
So for Transportation Committee, I think the main thing was that we did not have a quorum earlier this month. We had some volunteers, I think, Tanaka, council member Jackson, and then
somebody else.
One other one. And so hopefully in February, we'll actually have a quorum. It is open to all of our board members, so if you are available, it meets right before the steering committee meeting on the second Tuesday of the month at 10:30 a.m. So come for transportation and stay for steering and lunch. The big items that will be coming back to the committee in February will be the recommendations for Measure R highway funding. Your city's submitted requests for additional funding for those projects. And then we have, I think we've reported on this a couple times over the last 6 or 9 months, but we've been spending a lot of time at the infrastructure working group working on updates to our Measure M programs. I'll save it for next month, but it's a new way of an additional way of allocating some of the funding to cities so that some of the smaller cities have a better opportunity to get some of the regional dollars. So hopefully we'll be getting recommendations from the Transportation Committee in February for both of those, and they will come back to you at your meeting in February. I think that was it for.
Yeah, and I don't know that there's much more on the local travel network. We're going to be meeting with Gardena. Lawndale has submitted a proposal a project application. And we just applied for yesterday for a Caltrans grant that would look at parking opportunities for micromobility. If you're really serious about a tricycle and a bicycle and everything else, they all park differently and they need charging if they're electric. And so if we want to encourage people to buy these things, we really want them to be able to park safely and securely. So we've asked for money for a study on parking for our local travel network. So you'll hear more about that. Hopefully we're going to get the grant. So I don't think we have anything else to add. I don't see our person. Okay, so legislative briefing. We had a legislative briefing, as we do it quarterly. We had it scheduled for January 12th or something like that, right in the middle of the fires. It was also the National Day of Mourning for Jimmy Carter. So we did cancel we thought we were postponing the legislative briefing. The steering committee asked that we poll legislative offices, see if we could do it next week, January 30th or 31st. Natalie has contacted them twice or more, and we got 2 responses. One was no, I think, and one was maybe or something. So we are recommending that we cancel.
So moved.
You do have before you a notice. Do we have it? No, we don't. We have a February 20. We don't have the meet and greet. Yeah, we have a legislative meet and greet on February 28th. That's, is it again?
8:30 in the morning at the Nakano Theater in Torrance.
Right, and that does get legislators.
If I can, your offices to reply to the invite, please. I haven't heard back from you yet.
Yes.
We're still working on inviting our assembly members, congressional reps, state senators,
Right.
supervisors, and
It's a different format than our legislative briefing.
come before, but we give all of them an opportunity to give a spiel on what their priorities are for the year. And then we end it with Q&A for.
And we do it in partnership with the South Bay Association of Chambers and the League of California Cities LA Division.
SBACC's been advertising it heavily.
Okay, well, it's time for us to start. So, February 28th.
28th.
So now General Assembly, you've got before you our birthday celebration General Assembly flyer. And it's time to, here it is. It's time to RSVP. As you know, we are charging for lunch this year of $15. You can do it all on the website. And we have, we still have not finalized a keynote speaker. And the one thing that did come up is, and I wanted to ask your opinion, we usually don't pay for speakers. We don't pay for speakers. I shouldn't say usually. We don't pay for speakers. We pay for their expenses if they have expenses. So we've flown people in, we've, paid for their taxis, whatever, but we've never really had, I think, paid a speaker's fee. We asked Mike Madrid, who many of you have probably heard of, if he would speak, and he has a speaker fee of $5,000. So we can afford it. I mean, we could do this, but I wanted to make, I mean, you might have heard him, you might say, I don't even like the guy. So I wanted to ask if you thought that was something we should be pursuing.
I have a bigger question, Jackie, and that is with this hot, exciting topic of our birthday celebration and a charge for lunch. Are you a little worried about attendance? Or should we be a little worried that we might have a party and not that many people show?
I don't know, because we want you all to register, so we'll find out. I mean,
I just worry about the totality of being too ambitious, particularly with the subject matter not being quite as cutting edge, nothing personal.
And the board member have to pay?
And then people.
oh, well, I mean, your cities will pay for you.
Yeah.
The reason we've never charged before is that your cities have to pay, and that just seems silly, but the problem we have, and the reason for those of you who don't know, the reason the idea was to charge is that people say they're coming, we order them lunch, and then they don't come.
Show up.
And so we've been paying for a lot of extra lunches. And so we thought we'd try this.
The catering is always the largest bill for the event.
Oh, yeah.
I mean,
Yeah.
by far.
So,
$20,000+, and there's always a lot of food left over. And so the board felt that charging something will get people to kind of commit.
I get that, but it's.
I think, your question is, will people come? I think if we have will Mike Madrid bring you there? That's the question I'm asking. Is we want a keynote speaker who will talk about the future. We're going to talk about what we've done and all of our accomplishments, which I think can make a nice event. But I agree with you. You have to have something that's also a draw. And so I guess my question to you is, would Mike Madrid be a draw for you? And we want it, what we're asking our speaker to talk about is we're going to tell you what we've done for the last 30 years and how we've brought cities together. But what do cities need to know, or what should they be looking out for the next 20 to 30 years? Where are we going? Where are we going with these disasters? Where are we going with the government and the loss of local control? Where are we going with all of these issues? So that's the subject matter that we're asking our keynote speaker to talk about.
Will they give us a family and friends discount?
Well, if any of you know him and can get a discount, we would love that. I don't know him. So.
Anybody BFFs?
I know people who know him. I could ask.
I
mean,
may actually contract with one of his groups, so I would check.
You'll ask
I will check in with them.
Okay.
See if we can do something.
Nice.
Okay.
Thank you.
Send me a little blurb. I need to.
Okay, you'll get something from David, and I think if we can, I mean, if you're interested, we will get Mike Madrid. We also have other invitations out, but we don't have they haven't responded yet, so we might get somebody else too.
I mean, he puts out emails that he gives to everybody about what's going on.
Right, we get those.
So it would have to be something over and above that type of thing, because people get a lot of information
Yes.
from him anyway.
That's about what's going on in the cities today.
Well, and the state, but again, I don't know if it'll be like system overload, like they get a lot of info from him, like.
The other thing they were gonna have, we thought, because it worked, I thought very well last time. We had a youth panel for those of you that were in that one, and talking about what they want for the future, what they want cities to look at for the future. And we are gonna have a youth panel again. This time, what we thought we would do, since we have some incredibly talented 20-year-olds that are working for us now, is have our own staff, our youth part of our staff on a youth panel. And it's been a whole revelation. I just have to, two asides. We had a celebration of what we all did on our Christmas vacation. And one of the people put up, you'll all understand this, I think one of the people put up her family with all in like Hollywood squares. And it was really a cute picture, And so one of our younger people said, "What's Hollywood squares?" So we're constantly having to sort of interpret at our staff meetings. It's really been fun. So anyway, so we will then pursue it. If you will help us to get that fee down. I mean, he wants expenses as well. I don't know where he lives. I assume Sacramento. I don't know.
Our teacher.
Oh, I think.
Yeah, so we will, at least we can firm that up and then we will be looking for more exciting things that will get David Lesser to come.
Come on, dude.
Yeah, the last thing I wanted to mention to you is it's Form 700 time that, and this year, you usually get Form 700, you have to do your annual. And you usually get it from Natalie. You have to do a different one for the COG because it's all South Bay. Natalie is not sending them this time. The county is doing it. And so, but Natalie will be notified.
You'll nudge us.
Yes,
Electronic.
You need the nudge.
Yeah.
it'll be the Natalie nudge.
Yes.
I have to tell you that I filed mine for the city of Hawthorne. Now it's giving me trouble to access to do any others. And I have to do like 4 more 700, and it's not let me do it because it said I done it, but I only did for the city of Hawthorne, right? So I'm gonna send them, hard copies.
And, okay, and I'll work with you too.
Yeah, the new system
There's a new
sometimes.
system.
They don't always work well.
So because they send me a passcode, but it allowed me to do the city of Hawthorne, but that didn't allow me to do for another other.
Yeah, and it has, so
Yeah.
I'll work with you. I'll make
Right.
sure you're all good for us.
And I also wanted to let you know, February 1st triggers our opportunity to serve. We have a rule at the COG that every 2 years, right? Every 2 years, we advertise positions that people are in that don't have a time limit. So although incumbents can reapply, we open those positions up. I looked today and Jim Gaisley, who represents Lomita, Torrance and Carson, I think. His seat is up on the SCAG board. So those three cities will receive a notice. Britt Huff is the CalCog representative for the COG. That's the California Councils of Governments. I think she's going to be the president though. So I'm not sure that I think she'll probably want to reapply. Santa Monica Bay Restoration Commission, the delegate right now is Dean Francois. I know he likes it very much and he probably will reapply. But the alternate position is open. That was Eric Allegria from Rancho Palos Verdes. So you'll be hearing about that. South Bay Chambers of Commerce, Barry Waite goes anyway. And I thought Eric was doing that. So I don't know if you want, if we had.
Thought I already got saddled with that.
Okay.
Saddle.
So it's not available. I'm has to open. If you're gonna go anyway, we'll open it up.
I'm gonna go anyway.
So then that's his position that'll be open. South Bay Aerospace Alliance, that's Rodney and Huff, I think. And then there's always 3 seats on the Metro Service Council. And so you're gonna get this email from me with all that information sometime around February 1st.
Right.
So, and then AQMD is up. I don't want to say anything.
Yes, hi, everyone. My name is Tasha Sturt. I'm the mayor of the city of Gardena. And the position, the representative for the AQMD is coming up very soon. We don't have a date yet, but I'm going for the position. It was held before by Jose Salachi. And he's since gone on to the assembly, so the seat is now vacant. And so I'm one of a couple of other people who are going for this position. So I'm just kind of here just to let everyone know that I'm running for the seat. I'm somebody who's been on the city council now for 15 years and been a city council member, a city clerk. Now in my 2nd term as mayor. And so I'm just, looking to run for this particular position.
Yeah. We thought Rodney was handling it all by himself,
No, Rodney's my work husband, so.
That's a long story too. I'll tell you about that one day. But actually, she's Tasha's just one of those people that I always told her, I said, I'll follow you anywhere. She's that good, so.
You didn't mention you're a Rotarian.
Oh, well, I'm an Elks. I'm a Kiwanian, a member of the Rotary Club as well. So,
You need to join the Lions.
you know what? I'm almost there. They pinned me down last
Yeah,
week.
but you haven't seen her do the lion dance.
Oh. Thank you, work husband.
I have nothing else.
Secrets. Yeah.
All right, any announcements from anybody from the floor? Okay.
Oh, you know what we didn't discuss?
What?
The fire. Did anybody want to say anything about the fires and the emergency?
Yeah, they're bad.
Yeah, that's right.
Yeah, in fact, our city manager, he kind of got close to his house.
Oh, really? What?
Jocelyn had her hand up. I don't know if she wanted.
Hey, Jocelyn,
Did you want to speak?
speak
Thank
to
you.
us.
No, it wasn't about the fire, so I can pause and wait for my comment, if that makes sense, or I can go ahead.
No, go ahead.
I just wanted everybody to know that there's a car wash in Mid-City at 2355 Crenshaw Boulevard that took me an hour and a half to get to and an hour away from the meeting tonight. So I'm so sorry I wasn't able to be there. I don't know if that's happened to anybody else, but I texted Natalie to make sure that, quorum was good. I feel really bad, but just make sure you got the right zip code. Thank you.
Well, we're glad you're here.
Okay, just let me say that Hawthorne, we send our mental health health van to the Santa Anita Park, to give mental health counsel to the Altadena folks that got. So they've been there.
Is there, Johnson, did you want to say anything about it?
No, just, just as a concerned constituent, I just feel like it would be a good time to assess that there's more we can do as a COG to make sure our communities are aligned. I was talking to Brandy Villanueva from Area G this week, and it does sound like our cities individually have plans. I'm not sure if the constituents know what those plans are. But one of the concerns I had was here in the Palisades and the evacuation stories from Altadena, they had to evacuate during rush hour traffic and they couldn't. And so our roads are all interconnected. We got Hawthorne, Aviation, PCH. If there is an emergency, do each one of our police units do their own territories, or is there coordination? So those are just some of the questions I have, and wondering if there's a role for us in the COG to uplift these questions and maybe provide some sort of forum to discuss our emergency preparedness.
And I would also just add the communications because I was in an area that was very, right there, right? And we had the black outages and everything. But we lost cell phone service. We lost every kind of service. We could see fire. We didn't know if we needed to leave. We didn't, you have 100-mile-an-hour winds. So I think cities need to know if you're going to be able to talk to your constituents or not, because we used to get reverse 911 call, right? And so when we had fires before, the city would call us and say, if the wind changes, be ready to go. But we didn't have that this time. So, especially for you on the Hill,
Right.
if you look at the populations that were, a lot of the people that died, there were a lot of your senior populations, which is a lot of your Hill cities. So
Not only that, there's just one ring road around the peninsula that's one
Yes.
way each lane,
Yeah.
Right.
one lane each
And
way.
if they don't even know to leave,
Yes.
when it, so.
So anyway, the whole point is having redundancy. So you tell them all these different ways. I mean, we're still testing them out. But we put siren system up in our city. And so it was a little controversial because it's not hooked up to Genesis. It's a different company, but they're the same people that put sirens in Paradise. So they're very hot to make sure these things work. But ideally, it could be not just sound to like an alert like you do in Kansas, whatever, but it also has voice. So you could tell people that this evacuation route is closed, do not go here, so that you don't waste time on a route. But it's a work in progress. But the AI Pano AI cameras in the peninsula are huge. Because they will, and that's something that we should be recommending for South Bay. They're costly, but they can see the wisp of a fire and that the AI will pick it up, then it'll triage it to a human who will be able to say, is this really a fire? Is this somebody's fireplace or doing a barbecue? And then it immediately goes to fire and they can snuff it out. Then that's the real deal, is to be able to get it at its incipiency. So I think these are things we need to.
Apparently it picked up the Harbor City fire.
Picked up Harbor City.
Palisades fire.
So that is, because people were talking about they could see smoke and they wondered, is that coming from our city? And because the Pano AI camera would tell the city manager, through the system that this is from Harbor City, it's not in your area, we were able to inform our residents that it's not in our city.
One program I've worked on in my city, particularly when I was mayor back in 2017, is a terribly named program called Map Your Neighborhood, with which many people might not be familiar because its name doesn't denote what it is. What it is it's an opportunity for neighbors to organize amongst themselves and identify who has certain skill sets and emergency supplies. Because when a major disaster occurs, we're going to be without first responders,
Right.
without much of our infrastructure, including water, for a prolonged period of time. And perhaps that's some of the learning that we could learn from these fires.
That's
Thank you to Jackie, by the way, for helping coordinate that program we had with Lucy Jones, where we were able to see the Inglewood Newport fault, because her biggest concern is not just preparing for the big one, but what happens afterwards, particularly when our water, our highways, many other infrastructure is going to be out of service and we're going to have fires. So I would be in support of the COG looking to sponsors or at least help support communities to be able to explore this volunteer type program, which
I
might.
want to mention to your city managers and tell them they should be asking me because it would be helpful if I heard it from them. Craig, does PD still have PV cares?
Yes. And I know Carrie and others, the 4 cities on the Hill are working together on a disaster program as well. So if a fire were to start in Rolling Hills, we're prepared, et cetera. Not just our city, but the 4 of us. And certainly others could be a part of that.
And we do a lot of community events. So if we're out in the field. So if your city has specific information that you would like us to share with your residents, that would be fantastic. And then we're also getting ready to do a lot of work with individual businesses. And we can also take that out to businesses because a lot of times businesses don't know, what's going on because they're not connected to the regular community systems.
I haven't launched it yet, but I'm from Philadelphia when I grew up, and we used to have snow days back in the day. And sometimes they would do it in advance, post school the day before, knowing that a big storm was coming.
Yeah.
I think we really should have red days for schools where the fire danger is so high, they shouldn't even come to school. They should be remote because they're not going to be able to get out of the town. It's going to be pure gridlock if we have anything that were to happen.
Yeah, that was an issue in the fires we just had. One of my friends is the superintendent of the Linwood School District, and he got a lot of flack for having the kids come to school. But in their case, and where they were, few residents have air conditioning, but the schools, almost all the classrooms are air conditioned now, and therefore have some ability to control that particulate matter. It's just one of those things where whether or not that's the right answer sure depends on your geography and so on. But, it's a really important point you bring up. And also, this all goes back to CERT, which we're trying to work together with the peninsula cities and, with Lomita on that, because none of us is big enough to be able to do it ourselves. But together we certainly can. So, and then Torrance has actually been providing some resources as well.
We did a survey about a month ago in Hawthorne. A survey was done in Hawthorne. And I don't know, but if some other cities, but Hawthorne was part of this LA County, system, emergency system that we send our police officers to Santa Monica and to Altadena to help. So, and my colleague right here and Tanaka, we had 911 system, board of directors too, so.
Yeah, we have Area G. And Area G is a conglomerate of cities that when something happens, they.
So, well, Area G, and you have a thing from her today. We can have her come out, but I guess Area G, she's the expert.
Right.
What we can do is we can get the message out. So if we can figure out what that message is, that would be good for you.
We can take it out.
We can help you get that message out.
I think something that came out and it was just from people I was talking in Sacramento today. I got up at 3:30, I had like 3 hours sleep and I just came straight here from Sacramento. But at the league meeting, there's a guy from Apple Valley, a city council member, who talked about 30 years ago, he did a study when he was with the fire service of the Palisades area, and he gave them report that they'd had inadequate water supply for fires and inadequate water pressure, and nothing was done. I think it would be good for us as a South Bay to have reports done regarding water supply, water pressure, all of the things that would be needed in the case of a major event where we have this kind of gale force winds. I mean, not that nobody expected it to happen now, so, but we need to be prepared to know that they have the resources. The second thing he mentioned is that whenever, and this may be just funding, whenever there was a high wind event and dry weather conditions with low humidity, they would stage in high fire areas apparatus and firefighters so that if something happened, they were already there. And that was key, because the longer they have to react and come to it, that's when it gets to be a conflagration, and it's so hard to put out, especially in a high wind event, and that's what happened this time. So I think we need to go back to those basics and talk about that. And LA County is all of our fires, and Jennifer's here listening to me. So this is something countywide we need to, because there needs to be a best practices. We need to make sure this never happens again and get and one thing they said is before, and somebody actually said this, amnesia sets in and, in quotes, or they don't really get to it because, we will deal with that later. There needs to be a real study. What went wrong? What happened? What were the failures? And it be documented while it's fresh in the mind. And so you can actually do something about it, because if you don't document it, then it can recur. And like this study 30 years ago, who knows where that study went? The guys, don't you have it on your hard drive? Like, no, I don't. I'm hoping the fire service has it. So it's those kinds of things that we really need to make sure these things are documented.
Well, and that ties in, that, we just approved that new fire tax in November.
Yes, they have some money now.
So which I'm sure they don't have any of that money yet, but I know they're planning. Well, it's the perfect time to be able to adjust, because now they know they're going to have some money coming in. And we also have some new experience. So you combine those, and maybe what was planned isn't necessarily what is correct now. So
My understanding is that when the Palisades and Eaton fires were going on, at least my city, I think all the cities on the peninsula were in communication with Cal Water, and Cal Water did a water pressure test, and there was sufficient pressure. Of course, we don't know what sufficient is going to be.
Right.
And the other thing is that this past week, during the Santa Ana's this past week, my city manager told us that the fire staff was full on the peninsula and that they have pre-positioned trucks.
We were told by Chief Kane that was, we had two presentations, one at the city council, one at our city annual meeting for our homeowners associations.
Right.
He did make those representation. He thought that the water was fine. But there is that reservoir, in your city that is vacant, has been vacant for years. It
Right.
belongs to Metropolitan Water District, and they're not planning on ever doing, they say, oh, it's not needed. But I think there needs to be documentation, not just saying it's not needed. I think it should be validated.
Yeah, I think Chief Kane went to every city council and talked about redundancy, which a word is, you use that tonight. And
That is an obvious.
we raised that in our city council meeting, and he talked about all the other sources, and that's supposed to be for drinking water anyway, apparently. I mean, I agree, it doesn't make me comfortable, but, and to George, I think that the four cities are also going to talk about a community presentation in the spring. I hope we don't have amnesia in the spring, but, just everybody's traumatized right now, making their own preparations, I hope. And I think it's going to be a community presentation about fire preparedness, which would be different than the Peninsula Safety Committee or the regional safety committees, anything that they would decide.
Right. I also wanted to mention that, does everyone here have Pulse Point on their phone?
Yeah.
So Pulse Point is an app that it ties into the fire department's radio system. And anytime you hear sirens,
Oh, do have
you
it.
just look at this and it comes right up. And our citizens were scared, very scared that there was going to be a brush fire, in our community, and everybody was calling and everybody's emailing and everybody has a solution, but real fear. And so it was nice to have this to say, oh, that's a medical emergency that you're listening to or whatever.
And Genesis, do you have Genesis?
have
For
Genesis.
your zone, for your,
Find my zone.
Yeah.
yeah, so it basically you just put, that app, it's called Genesis Protect, GENASYS. And that is the notification system for, evacuation that we get. And so that you can populate, but it's for a lot of it's actually all of LA County, I believe. So you can populate your location, your loved one's location, and they'll tell you if there's any fire active or any, they'll say the zone status is normal if everything's safe. So that's nice to validate, because we were getting in our city, maybe elsewhere, calls to evacuation warning based on other fires. And they were in error, and it was like, one was 1:59 AM.
Yeah, we, everybody was.
So they got, yeah.
Yeah, so I just said, they need to send out the same message to say this was an error, rather than just like, oh, we're all telling you it's an error. And plus, people need to get these apps so they could, I just looked on, at that point, all I had was Watch Duty, which is helpful because they get derivative from Genesis, but I have Watch Duty, Genesis Protect and Pulse Point, so, you can look at that.
We did lose internet access to, like, we lost everything. So just to think about during an event.
Right, and that's where the sirens come in. That
Yeah.
was for when
Yeah.
you have no electricity, no internet.
And we have good service.
Well, so with no internet, did you exist during that time?
Apparently not.
Is there life before internet?
Yeah.
Okay, so everybody stay safe and
Okay.
buy an app that might work and we are adjourned.
If you have.
Thank you.
Where are you?
Monrovia.